Hey, what's going on, guys? Welcome back to Jeremy Scott Fitness Podcast Radio Show, coming to you on this Sunday, July 13th, 2025. Hopefully it finds you staying safe and staying sweaty all at the same time. On today's episode, we are wrapping with my man, Dr. Bryce Hendy. But before we harass him, a couple quick housekeeping things. One, the Jeremy Scott Fitness app, we just finished up their Summer Advanced Metcon for you guys. We're going to pick some winners and hook those guys up with some packages this week. If you guys want to pop in there, obviously all my weekly workouts are in there live, 27 full programs. Plus, we just dropped this old school 34-day to fit challenge in there as well. If you guys want to check it out, jeremyscottfitness.app, you can always get a week for free. What else are we cooking in there? We're going to do a 50 days of fitness to cap off the year. The Old Man Strength program is always rocking. We're doing the part 2 of that. I'm probably going to film it sometime in September. But again, there's more fitness in there already than you guys would use in like 1,000 lifetimes. So if you want a week for free, hop in on me, jeremyscottfitness.app. The link is in the show notes for that. And then obviously you guys know the one thing I take every single day and I never miss. Shout out to my homies at AG1. The next gen is out, new, even more, how do I say this, enhanced flavor. I always thought it was the best tasting in my opinion, but it is a little bit sweeter these days. I'll share more about that probably in the next week or two here. But if you guys do want a free sample pack on me and you struggle to eat, fruits and vegetables every single day, or at least as many as you're supposed to, this will help kind of cover the gaps in your nutrition. I can have Monica send you a free sample pack right to your front door. I don't care where you guys live. We can hook you up 100% for free if you like it. From there, we can hook you guys up with 10 free travel packs and the full kit. So all the info's in the show notes, but feel free to reach out to us, DM, email, wherever it is. Otherwise, drinkag1.com/Jeremy Scott hooks you guys up with all the free stuff today. Always a mouthful. Good. Bryce, welcome, my man.
Thank you. Thank you for having me.
Give us the origin story. Go back as far as you want to. How did we end up here today?
Yeah. Let's go back to high school. So a lot of sports, a lot of injuries. Ended up in some PT quite often. And
what was the big one?
Big one was a bad high ankle sprain. All 3 ligaments in my medial ankle playing quarterback in high school.
Nice.
And yeah, that was a brutal one. Ended up in PT. Guy I was seeing was just a bro. He was awesome. And at that time, I was a junior in high school. And, they're always like, oh, what are you going to do with your life? What are you going to do? And I was like, I don't know. I know I don't want to do anything with math. I don't know where that lands me. And I was playing baseball at the time too. And I was like, I'd like to play professional baseball. But I knew that was a bit of a pipe dream. Like you just...
Yeah, it seems like way more fun than a real job, yeah, for sure. Yeah.
And so they had like counselors and stuff, and they're like, oh, what are you going to do? And I was like, I don't know. Like, I'm going to PT right now, and that seems pretty cool. The guy just kind of works out with people all day long. He works with athletes. So like, I could do that, I think. So I went and job shadowed him for a little bit. It was cool, but it was not exactly what I was looking for. I'm a very hands-on, tactile learner. And just in general, like I like to have my hands on and like be doing things. And with PT, you do that. But also, at least in the area that I was living at the time, a lot of geriatric patients. And so it's a lot of hand bikes and teaching people how to walk again, which I think is very important. It just wasn't for me. So now I'm back to square one. Don't know what I want to do again. Kind of leaning towards medical field, but I just don't know exactly which direction I'm going to go with that. My uncle, who lived in Grants Pass, Oregon at the time, he was a chiropractor. To this point, I hadn't been to a chiropractor yet, and I never knew what they were doing or what it was about.
Yeah.
So I'm down there for Christmas break. He's like, hey, like, have you figured out what you're going to do? And this is my senior year now. And I'm like, no, I don't know. Like,
but isn't that crazy though too? Like you ask a kid who's 17, 18, like, what do you want to do for the rest of your life? Like, how the fuck are you supposed to know that?
Right. But it's such they hammer it on you. I don't know about now, but this is 12 years ago.
Yeah. I feel like maybe it's changing a little bit just because the ROI on college for a lot of things is not, I don't think, great. If you're going to be in the machine, right? Like I want to be a doctor or I want to be a PT or an accountant or whatever, sure, because you have to do the steps, or like an attorney. But if you're not, like for what I do, this is all made up, dude.
Yeah.
It's crazy.
Yeah. Well, like blue collar jobs, like that's a huge industry right now.
Yeah, I would say, yeah, if you're going to like learn an actual skill, that is transferable.
Vocational.
I know. So you do that. So you're 18 or so. You're trying to figure it out, and you meet there. You're like, maybe I'll try the chiropractic stuff.
Yeah. So I go shadow him for a week or so, and I was like, oh, this is different. Like, manipulating, working on people every visit. And the difference that I noticed too was relationship wise, like the PT office that I was shadowing, at least, it was very much like transactional, like come in, do your stuff, see you next week. Whereas when I went to watch my uncle work, it was like, oh, hey, Billy, like, how are the kids? How's your low back doing? And he had surgery last year. So just more personal, I guess.
And it's his own practice?
Yeah, it was his own practice.
I mean, I feel like that's I can't say like for every place because I don't know everywhere. Like there is like the PT mills and the chiropractic mills too. They're one and the same. But if you can be in your own, and not that because I will say like it's crazy because like the best like pelvic floor PT in my opinion like works. She's the clinical director at Spooner, which is a huge fucking machine. But she is the best. Like even the people at Mayo are like she's way better than the people we have, which is fucking bonkers because you're talking like the Mayo Clinic and then whatever people do think about either place. But the point is it's still the volume she would have to see is much greater than like, let's say you guys see, or like our friend who's a PT who their practice is more similar to yours, where it's not the big machine. So yeah, where you go definitely matters.
It depends.
Yeah.
It matters, definitely. And that's like, I think at that point in my life, I'd only had 2 exposures.
For sure.
One, I just didn't.
And this is like
jive with.
what year is this?
This would have been 2013.
And I'm sure there was a lot of little places too, but I feel like now there's way more like concierge style and like mom and pop style places because people want that.
Yeah, that's what people are after. They want the one-on-one. They don't want to be in the mills, right?
Yeah, and that's what kind of sold you on it.
Yeah, and then from there, go to college. Played 1 year of college baseball. Ended up hurting my elbow. Decided to hang it up, and I was like, because I need my arm. If I'm going to be a chiropractor, I got to have an arm that is functional.
For sure.
So yeah, hung up the cleats and then just focused on school. Finished up at OIT in Klamath Falls, and then went back up to the Portland area and went to Western States, and then moved back to Grants Pass and took over my uncle's practice. And then 4 years of doing that, and then last year in February, my wife, she works for Dutch Bros, and they said, "Hey, we're moving you guys to Phoenix," and I was like, "All right, let's go." So
no shit.
We're here.
That's how you got here.
That's how I got here.
Yeah, you ever been here before or no?
Yeah, we come down here. We have family and friends that live here.
Okay.
So we'd been down a couple times. Never really considered moving here, but we liked visiting.
I mean, maybe not this month, but the weather is way better.
Oh, it's phenomenal. We moved in October, and like the winter down here.
Oh, it's money, dude.
Perfect.
Yeah, no, because my wife is from the same hood you grew up in, so that's why I wore my Coug hat today.
Yeah.
But no, and I don't mind going there in the summer, but this is not a knock on somebody. It sucks, dude, the rest of the year. Like, I'm not a rainy, gray, I'm not a snow guy either. I'm just like a sunshine dude.
And you don't know it until you move out of it, right? Because growing up, you're like, yeah, it's rainy, like that's just our life. And then you move out and you're like, oh, there are places where it doesn't rain all year long.
Yeah, I wonder, like, when I was a kid, like, we would, again, I'm, like, way older than you. So, like, I'd watch, like, 90210. And I'm like, oh, Beverly Hills. It's sunny. This is the shit. Like, I want to be there. Like, in my head, I'm like, this is the best.
Yeah.
Like, it's sunny every day. Like, because when I'm a kid, it's Minnesota, so it's 4 fucking degrees. It sucks. And you're sitting at a bus stop, staring at your feet, freezing your dick off. Like, this isn't fun. And you just dream of the summertime. Like, the summer is the best. And I'm like, why don't I just move somewhere where it's summer pretty much the entire year? And I will say this, like, when people, I think I said this fucking Friday on the pod, people are like, they live in Wisconsin, and like, I'm just not motivated. What should I do? I'm like, move out of Wisconsin.
Yeah.
Because it's not sunny there. It's cold. It's dark. It doesn't seem ideal.
Yeah. There is something to be said, like, if your environment lends towards more like physical and outdoor activity, like, you have more motivation.
100%.
Yeah.
And not to say, like, in the Pacific Northwest, it isn't sick in the summertime. It's great. It's light out till 10 o'clock at night. You have some of the most amazing shit ever. But when it's dark and cloudy, not ideal. No. So I'll ask real quick. Seahawks, Mariners fan? What are you?
Oh, yeah. Seahawks, Mariners, Blazers.
Still to this day?
Till this day.
Yeah.
Yeah. Waiting for that World Series for the Mariners. One of these days.
I mean, at least as a Twins fan, we have that. But the rest of it, it's been a painful ride, bro.
Yeah.
So, like, what you do now, like even in the practice you took over, like, how is what you got? Because again, when people say like, "Oh, I'm a chiropractor," it's almost like PT or like even like OT, if people understand what that is, or like what physical therapy is. Like, you have an idea. So forever, in my head, before I met, we've been doing this for 7-8 years now, and I've had, I don't know, maybe 15 PTs on, probably the same amount of chiropractors. And my idea of PT was like, oh, so-and-so got injured. He's got to go to PT now. He shows up, meets the PT, gets a piece of paper, does his bullshit exercises, and just goes on. And not that they're bullshit, but you know what I mean? Like it's very, it's a machine. And for a long time, before I did this, oh, you go to a chiropractor, you go in, you sit at a table, they crack you, and you just roll out. But the guys I've had, like I call him my tissue guy, he's actually a chiropractor, I don't really get adjusted like that. It's so much more that goes into it. So if you, for people who would listen, like what you do versus like maybe what the old school idea of it is, and obviously it's patient to patient, but just maybe like a general scope.
Yeah. So what we do,
or like
now,
if I came in, what would it look like? Like I walk in off the street, boom.
Perfect. So we do a pretty like full assessment. So we're looking at, just your general movement patterns. We're going to do range of motion, check all that. A couple functional movements, so sit and stand, squat, have people bend over just to see how people move. I mean, that's the biggest part about it.
How do you guys do it there?
With the movements?
Yeah, like in our world, like FMS has their own shit, which nobody can pass, which is not even NFL. It's crazy. I could talk about, and Gray is great, and he does good stuff. And there's obviously use for it. The dudes at DexaFit, Scottsdale, we went over there, did the whole show. The RMR VO2 Max, we did the full DEXA scan, and then they have a 3D movement screen.
Yeah.
I don't know what they use. It's like on a little computer. They snap the pictures, they go through it. It's very fast. It is pretty accurate for the most part. Like if you know you have a hip hike, it can point out the hip hike. What was it? LiDAR. Yeah. It was pretty for what it was worth. Now, obviously, what you guys are doing is for a more therapeutic. Like when I go through those, I'm like, I'm never going to have a perfect overhead squat, so who gives a fuck? Yeah. But it's nice to know.
So what we're looking more at is like, is there a shift?
Like dysfunction.
Dysfunction. Yeah. I mean, the LiDAR scan, actually I went to DexaFit as well.
Yeah.
And I didn't do the movement assessment, but I kind of watched how it worked. It is interesting, and it will give you very...
For as basic as it is.
Yeah.
Because the guy, no offense, the kid who was working, I don't know if he knew up from down. And I mean that in the nice way possible. The dude who owns it is great. The other kid, I'm sure he's a rock star. But I'm like, what the fuck? I'm like, I know what I'm doing. But I always do it from the point of like, if someone came in off the street, we're going to measure like dorsal flexion of the ankle or something. And I can tell one of mine is from previous injuries is habitually tighter. And it can point that out, which is kind of cool.
Interesting.
But like, what can I do with that information?
Right.
Your guys is more, and we do it here when we do our movement screens. It's basically, we call it like, it's just like it's like a movement assessment.
Yeah.
Can you do the basic handful of things? And if you can't, where is the imbalance and what is it coming from?
Yeah. And so throughout that, we're also asking like, does this movement increase your pain? Or do you notice a new pain with this? Because that kind of gives us at least like a pathway of, they're coming in with XYZ symptoms, sure, but without, with going through these tests and range of motion, are we able to either get the symptoms to go away with just basic movements? Because if we can, great, that's a home run right there. We can just teach you how to move better. We don't have to do anything else.
Yeah.
You're on your way. But if along the way we're like, oh, now your ankle's hurting too, or it increases pain, it's like, okay, now we need to kind of break that down and let's look at more so how the tissues move, how the joints are moving, and then we kind of go at it like that.
And like, who do you see like the biggest kind of demo, at least now anyway?
Now?
Or do you have or is it whoever?
We have a pretty large demographic at the practice I'm at now. A lot of athletes and a lot of people who are seeing like trainers and like working out. Just, I feel like Scottsdale in general, there's a lot of people who are like very into health and fitness. And
it's a little different.
Yeah, it's very different. I like it though.
Yeah, they'll pay for it.
Yeah.
Yeah, it's interesting. Whether they're trying to be optimal or anything that we can't like fix here with the basic stuff, like we just refer out to.
Yeah.
Especially if it's like chronic stuff for them. Yeah. So like on a day-to-day, how many people do you tend to see?
Right now, because I'm still kind of building up, my schedule, I'm seeing like 6 to 10. But even then, Dr. Byrne, who's one of the main docs there, she, on a full schedule for her, she's like 15 to 18. So very minimal. We do 20-minute appointments or hour-long or 40-minute long. So that's the nice thing about being a cash practice too now is you have the time to really do what's needed versus an insurance practice where you're kind of stuck in these guidelines of, hey, we can't do this today because I don't have clearance from your insurance.
And like, can you explain that at all? Like to someone who listens, like the difference between the two places historically, like if someone's, hey, they're looking at, well, because here's what I hear a lot, and maybe not our demo here, because Scottsdale is not the real world. Not even, it's just not. It's not even close. Because the amount of money people, like where I grew up, it's drastically different. Where I grew up, it'd be more like, well, my insurance doesn't pay for this. It only pays for these places. So I can't go here. I can only go to the insurance place, even though, yes, this costs more out of pocket, but it's dramatically better.
Yeah.
And so explain that to people, like what that kind of looks like.
Yeah. So insurance, for one, you're going to pay a copay or a co-insurance as well, still as a patient. On the doctor side of that, the doctor is not going to make. So if let's say they charge out for a spinal adjustment code, $70 and manual therapy at like $30, so $100 visit, the chiropractor is going to make maybe $40 on that. So from a standpoint of like, well, I want to care for people, but I also have to make a living because I have a family to support as well.
Yeah.
But also the flip side of that is if a patient comes in and I've treated their neck for 2 weeks, but now they've got ankle and low back pain, I have to go through insurance to get clearance to treat those new areas because I already submitted an authorization request for the neck pain.
No shit.
Yeah. Oh, yeah. It's ridiculous. There's so many hoops to jump through. And then at the end of the day...
So you couldn't like just be like, hey, now I'm going to do your ankle today?
You could. You won't get paid for it.
Bro,
and that's what I did. I mean, at my practice in Oregon, like a lot of times, like someone comes in and they're like, hey, I know we've been working on this, but I was playing pickleball over the weekend and, my elbow flared up. It's like, I'm not going to tell you no. So I'm going to take care of it, and I'll submit it to insurance, but 9 times out of 10, you're not going to get paid for it. Especially if it's not something you diagnose at the initial visit. You can do a re-exam and diagnose that new injury, but then the patient's also going to catch a cost on that too of a re-exam fee, and then the insurance still may not pay for it.
And it seems like bullshit, huh?
Oh, totally.
Yeah, that's because like when I go, again, and I think we could talk about like how healthcare and sick care and how that things work. Most things are retroactive, not proactive.
Oh, yeah.
When people come see you, typically. I referred a guy to you who's been tight for 40 years, so you could Google him anytime. He's doing the work, though, so it's helpful. But my point is I go on a routine basis. Not that I don't ramp it up if something's tight or bugging me, but when I go in there, it's just like, hey, what is it today? And we could work on, if I have tennis elbow, it's that. Like, let's work on, like, the forearm extenders and everything around the joint. Or one day it might be psoas, iliacus, whatever, and we work on that. But there is no submitting a code. There is no whatever the fuck. You don't need to assess shit.
Yeah.
Let's just like have a dialogue because you've worked with me for 10 years. I think that's maybe the biggest benefit. That, and you can spend the time with the person and actually help them.
That's a big part of it too, because now you're looking at the cash practice versus the insurance. So, restricted over here, the patient still pays, the doctor makes less. But now on the cash practice side, we also have therapies that as a chiropractor we're licensed to do that insurance doesn't cover, like dry needling, laser, pulse electromagnetic frequency, shockwave, like all these other modalities that you can do that really help, but insurance isn't going to cover those.
Really? Sometimes they do, or just depends?
Not that I've ever seen.
No shit.
Yeah.
Wow, dude, that's wild.
It's super restricted. And the thing is, like, those modalities too, they're really great at, like pain gating and getting people out of like that acute pain phase. Then we can really jump in and like fix the person. And so with insurance, it kind of sucks because then you have to say, oh, hey, I know you're coming in here expecting to pay your $15 copay today, but I think, this would really help. That's a hard sale to that person. And, to a person who is maybe not in the best financial situation, they want to use their insurance.
For sure.
Well, I still want to help you get better, but now we can't do these extra services to really get you over this hump. Or they feel jaded then because they're like, oh, I thought I was just using my insurance. So
that's kind of backwards.
It just creates a weird dynamic in that insurance realm.
And the old practice you had was insurance?
Yeah.
And now this one is
cash.
And you prefer this way better?
Yeah, way better.
Yeah.
For many reasons, but like
the volume of people.
Volume of people is great because now we make better money because we're charging for our time too, but we're able to give the patient whatever they need in that visit. So it's not just, hey, you're going to come in, you're going to get an adjustment today. We can't do anything else. That's all you get. Now it's, hey, I think today let's try this because, last time, we got good results with, this therapy, but let's try this today. Or, hey, they come in and they're like, oh, my elbow's hurting. Great. Well, we're going to work on your elbow today and your neck too.
How many people would you see like at the old place, like insurance-wise?
15 to 20 a day.
Okay. So still a good clip.
Yeah. I mean, I really tried to kind of be in that insurance realm, but kind of live on the outskirts of it where, I didn't treat it as an insurance practice. Like I was really trying to get people better. My thought was always like, if I can help people and they feel better, they're going to tell their friends and family. And I was in a small town too, so word of mouth was huge. And so I didn't hardly do any advertising to grow that practice.
That and for you guys, just to like you run yourself into the ground.
Oh yeah,
like when you see that many people in a day,
it's exhausting.
So is there like the misconceptions on like chiropractic or versus like a rehab or just like in general, like what people think it is versus like what you guys really do?
Yeah, I mean, a lot of people think we just crack necks and backs. We also treat extremities. So basically anything that has a joint and a muscle, we can effectively work on. And then at least the practice I'm at right now, like I have patients that I don't adjust and we just are working soft tissues, whether that's dry needling, cupping, scraping, the adjustment is a tool in our bag. It's not like that is what we do necessarily. I mean, yes, a majority of the patients we adjust, but we do a lot of other stuff too. And I also do a lot of corrective exercise with patients. So all of my patients are on some sort of home exercise program where we're working and, starting out at a base level of certain movements and exercises. And then as we go, as they can tolerate it and they're making that progress, then we're adding in more exercises.
Yeah, like behavior mod, essentially.
Yeah.
Because I think a lot of times people think like, oh, I just go in and get, I guess what is the main, because people think, hey, I just go in and get cracked and then I bounce. But like I said, like when I go into my tissue dude, like we don't do that. What is maybe the top like 3 things you do outside of just the adjustment part? Because I think when you do, if you think about like how the body is in general, we can adjust something, right? We can crack it.
Yeah.
But if the tissue around it is still tight as shit and there's dysfunction, it pretty much just goes back to where it was.
Exactly.
So like what are the handful of things that you do most often for people outside of that?
Outside of adjusting, so dry needling is a big one right now.
And for people, like, give us like the breakdown. Like I've had it multiple times. I actually have had it in my groin, which is fucking wild, bro. Because the adductors, dude, were just, I could have stretched for maybe 1,000 years. And it just wasn't gonna, like, and I've done everything. Like I can pretty much do the front splits, only with one leg in the front. The other hamstring's too tight. I worked on it for like 3 fucking years. So now my mobility for an older dude, I think is great, or anybody in their 40s. But the point was, I couldn't get these adductors loose, at least this left one. Like it just was so fucking tight. And they're like, what if we just try to dry needle it? And I'm like, oh, bro, we'll give it a shot. I mean, like a lightning bolt fucking through my body, dude. Yeah. Like I wouldn't say it was a pleasant feeling for sure, but I could have stretched for 1,000,000 years and never got it that loose. Yeah. And so from that instance, there's already this, almost feels like it's like a rubber band now. I can move it. And now I can get through the tissue that I need to. But without doing that, I don't know if it ever would have got there. And then I would do everything. I would roll it almost like, we wouldn't like grass and gua sha that close, but I could scrape enough and I could get enough rolling in there to get the tissue to kind of articulate, but it wouldn't work.
Yeah.
And dry needling is the thing that got me over the hump.
Yeah.
So explain that to people who are listening, like what dry needling is versus like maybe they think like acupuncture style.
Yeah. So dry needling versus acupuncture. Let's go back just for a second. As far as like all manual therapies, they kind of work on the same realm of like pain gating through mechanoreception. So mechanoreception is like touch sensation. So you got mechanoreceptors in your muscles throughout your skin. And so like when someone says, oh, like when you get hit with a baseball, rub some dirt on it. That like distraction, because the mechanoreception and pain share the same pathway in the spinal cord.
That's like your movement pathways and pain pathways.
Yeah.
Same thing.
So if you can block that pain pathway by stimulating that muscle or that area that's hurting, you can effectively block that pain for a moment. It's not going to, if there's tissue damage, that pain's going to start up again.
Yeah.
And so with all manual therapies, I mean, that's kind of what we're operating on there of mechanoreceptions, whether it's scraping, gua sha, cupping, like anything that you're manually working on those tissues, you're accessing or using that pain gating theory. And so then dry needling versus acupuncture is going to be not as deep as dry needling. Same needles, but they're not going near as deep into like the tissues. And then acupuncture is mainly targeting like meridians and bladders, which is like the traditional Chinese medicine. And so like, bladder 16 is XYZ symptoms, and so you'll target that for kidney pain or something. Whereas dry needling, we're going right into muscles. Like if you're adductors, like super tight or painful muscles, we're going right into those muscles. We're going right near the nerves, and we're creating micro damage in that tissue to kind of help stimulate that healing process. But then also, if they add in like dry needling with stimulation, now we're also basically kind of overriding that signal from the brain of why that tissue is tight in the first place.
To get it to
loosen up.
Yeah, so obviously acupuncture, some people do stim with that.
Yeah, you can do stim with acupuncture as well.
But the way I describe it in my monkey brain is like, because I've been to acupuncture in a bunch of different places, and I do believe in it, but it's passive.
Yeah.
To me. Like I can go to like Mayo, or I can go to my dude on the street and do acupuncture and I can fall asleep. And it's fine. And he can leave the room and I can come back and wake up and it's cool. I don't fall asleep in dry needling.
No. It's a lot more intense. And that's the other difference. It's a lot more intense too. Because we're targeting those tissues to make a change. Whereas like acupuncture, it's like, okay, this bladder just needs to be stimulated for, however long is needed to have the, desired effect that they're looking for. With dry needling, it's like we're going right in these painful tissues, and that's the reason why we don't leave people in a room by themselves with dry needling, because it doesn't always feel the best.
No, it's an acupuncture can be like that shit. We'll stick it in your head. We'll stick it in your feet. I couldn't imagine dry needling in your fucking head.
We do it.
Yeah, which is that'd be crazy to me. I mean, anywhere's crazy, but it's more like at least when I would go, like you have a dialogue when it's happening. Like, hey, what about this here? What about this here? And it's more almost like you'd put a mouth guard in, at least for me, because it's like, oh, fuck, yeah, that's the spot. Like, let's see if we can get that loose. More like, and it is deeper. Not trial and error, but you're trying to find the actual problem and fix it.
Yeah. Well, and that's the thing, like, too, like a muscle belly is so big, and you can also go into the tendons. You can go all the way across that muscle into the other side of the tendons, too, where it attaches. And so, like, yeah, you can start on one side and go to the other side. But then even with, like, doing the stim, like we always tell people, like, we want it to be slightly intense. Like it shouldn't be super comfortable, but it shouldn't also be painful necessarily. But it should be, you're noticing it. You're not relaxing necessarily.
And what's the most common spots you guys dry needle, like for the average person?
Low back, glutes are a big one.
No shit.
Yeah.
Like what is it when someone comes in, like it's just tight?
Tight glutes, whether it's, like a muscle imbalance. So they got super tight psoas, hip flexors that are just causing that pelvic tilt, so they don't get good glute activation. So that we can stimulate those glutes, and then we can also stretch and work on those hip flexors, work on the hip itself, get that capsule loosened up. Now they can squat better. Neck and upper back is a really common one, especially for desk workers, people that are sitting at the desk all day typing.
Yeah.
Like, and that's the thing, like
what, like traps, rhomboids?
Traps, rhomboids, levators. Cervical paraspinals as well.
Interesting. And if it's low back, is it just the glutes, or is it like what, erectors? Like what do you go?
Paraspinals, QL.
Oh yeah.
Yeah.
That makes sense. That shit gets real tight.
Oh yeah.
For everybody. Yeah, that's interesting. That QL makes a lot of sense. And I guess I could ask this too, since we're already there. The low back stuff too, because a lot of people, that's the probably the biggest thing that we hear from almost anybody. And I don't know if I'll get the stats wrong. I'm like, you could chat GPT it, I guess. Like the amount of people who come in with like low back pain, it's an insane percentage that it's almost like, I don't want to say like undiagnosed, but it comes from nothing really. Like it's not from like a contact injury. They didn't get tackled. It wasn't from deadlifting. Now everything is cumulative, so it all adds up. But a lot of times, if I'm guessing as an idiot from the outside, we just sit so fucking much. Like you sit in like hip flexion all day, like for hours and hours and hours. And then if you were to equate like how often are you in hip extension, and I don't mean this like midline, I mean like it's all the way behind the knee, is all the way behind the hip for most people. it's got to be like just barely minutes a day.
Barely. Yeah.
Depending on how they walk, if the stride is bigger, but even that is probably mid. It's probably not even that. And so when you have people come in, I'm sure we can talk mobility stuff and the pieces that you do. But how many of those people, obviously if you lose the upper back, you lose the lower back, so you're fucked there. But if your quads are so tight and the hip flexors are so tight and the psoas is so tight and it does move that pelvis forward just enough and starts to take those discs and kind of push them down, like a lot of times that will happen. So we'll get people here where, yeah, the glutes are shit. The piriformis, it's all shit at the end of the day. The whole pelvic bowl is trash. I go, but they would never think that it's coming from the front chain. And a lot of times that's people. We get people who have terrible low back pain or glute pain or a combination of the two. But a lot of times the front is the biggest problem because the quads are so fucking tight.
Yeah.
Like, do you see something similar?
Oh, all the time. Yeah. Especially in like retired athletes that have, developed, because you can develop your quad. Your quads are an easy one to develop. Hamstrings, not so much.
Do you know a dude, Dwan Blair, played for Pittsburgh, and then I'm way older than you. He played for the Spurs. He had no ACLs.
Yeah.
In either knee.
Yeah.
None. But his quads developed and got so strong, so big, he could play in the NBA.
Yeah.
With no ACL, which is nuts to me.
Yeah.
But to the point, like, yeah, you will. I don't know, but there is hamstring dominant people, but you train that way.
Right.
Like you hinge, you squat to do that. But most people, yeah. To your point, like the front is so. And even for me, if I didn't work on it, mine gets super fucking tight.
Yeah. And so with quad dominance, then you get to that anterior pelvic tilt, and that's just going to agitate the low back. Because then if you're in that anterior pelvic tilt, then your erector spinae are just fired up all day long. And that's like, nowadays everyone wants to stick their buttocks out and suck their stomach in. And so now you've got this anterior pelvic tilt where your erector spinae, your paraspinals, your QLs, they're just firing all day long. So really, is that what's causing the pain, or is it the tight muscles up front? I'd say it's a combination of both.
For sure.
But, one's driving the other.
Because I would hear, and again, this is just my take on social media in general. I don't watch anything anymore because I can't, because it's fucking, most of it's just, it's too much, man. There's so much great information. There is. The problem is just, it should be like a garden hose and it's a fire hydrant all day, every day. And once you get into a funnel, you're stuck there. And so forever you get this funnel of 22-year-old kids, no offense, like just sharing, like nonsense of like, oh, when my low back was hurt, I'm like, motherfucker, you're 22. Like, first of all, what are you talking about? And two, it's like all of these things like, well, the reason your low back hurts is because your glutes are weak. It's like, A, you don't know why anybody's anything, but I would hear that a ton. Like,
yeah. Or the core. Everyone always talks about the core.
And I'm like, but if you're an athlete and you played sports, I can almost promise you, dude, it's not because your glutes are fucking weak and it's not because your core sucks. Like it could happen, I suppose, but you made it this far and all those things are weak. Like it was like this overdiagnosis of like, we know the reason why. I'm like, every person obviously is individual, especially, but if it is an older person who maybe didn't train, like I get some of that. But the point is like everything became that on my feet. It was all the knees over toes shit and everything was just over the top completely. And again, everybody doesn't have to get into every single posture and everybody shouldn't. And I have a whole different talk on that in general. But the point was, is like when you see those guys, like you kind of take it on a case by case basis for sure.
Yeah.
And then try to break them down one by one. Is it, how much of it, like low back stuff you guys see is just from not training? Because I think people think of that where we rode today as part of their awful workout they did. I've never, knock on wood, seen anybody get hurt rowing. I'm not saying it doesn't happen. I'm not saying it can't happen. And now you're rounded the entire time. You actually protract as you come in, and then obviously you pull and row. And it's multiple. You're talking like hundreds and hundreds of reps. Never seen an injury. And that's the spine rounding. Even though like people say never round the spine, that seems like fucking nonsense. How could you ever pick anything up and live your life? I'll see it more often than not even deadlifting, not even squatting, more so from just inactivity. That's what it becomes.
Yeah, more often than not, it's people who are in great shape that work out. They bend over to pick up something off the ground at home, or they bend over to put their shoe on, and that's when their back starts hurting. And it's strained it.
And it's because the tissue's just...
The tissue is either overworked or it hasn't been trained properly to move in that pattern, or the biggest thing I think is unprotected movements, right? So you get into this... Okay, if we go talk about movement patterns, neuromuscular feedback loops. So we have movements ingrained in our nervous system where we can perform them without having to think about them. Bending over, tie your shoe, doing, very mundane tasks. And I think sometimes when there's so much input into someone's system, whether it's because they've been training a whole lot or they're sore and tight from training, or whether they got an injury somewhere else in their body. Well, now their nervous system is kind of focused on something else. They go to do this mundane task that they've done 1,000 times, and they just move in a way that they were unprepared. And now they just strain their low back or sprain their low back.
Well, when I see that too, I think of people, it's almost like my frozen rubber band analogy, where if you have a frozen rubber band in the freezer, you pull it out and then you try to pull it apart, it breaks. If you're so stiff and so tight, and then yet you go to do something quickly or drastic at home, like a lot of times that becomes, because it's just the straw that broke the camel's back.
Yeah.
So what is the behavior mod you give those guys where maybe they're already training, they exercise, they work out, they're just not doing probably the mobility piece, and they're probably sitting way too much. What is the blanket version you give those guys?
Yeah. So kind of break it down with them of okay, can you properly engage your core? Because for a lot of years, I'm sure you've heard this too, everyone was always told to suck in your core, right? You want to look tight, you want abs, suck it in.
Yeah.
Functionally, if you want to create that rigid core brace to support the low back, you need to be pushing out like you're having a bowel movement, like intra-abdominal pressure. And so working with that with people just off the get-go of okay, can you properly engage your core, and can you do it when you go to sit to stand, when you go to sit down, when you roll over in bed, can you roll over as a unit to where you're not straining that low back more? Breaking down those basic functional movements to start, and then working on kind of building those back up. But then also, okay, someone works at a desk all day long and they're sitting. How can we change, their desk ergonomics to better, suit their low back pain or whatever we're dealing with? Standing desk, increasing activity levels within their means. I think that's the biggest thing is your analogy, you're not going to go from the couch to running a marathon. You're not going to go from zero activity to no activity. Even if you were active before and now you've got an injury that's sidelined you for months, or I'm not just going to throw you right back in once your tissues feel better. That's just asking for another injury.
Yeah.
And so you kind of have to slowly build things back up, especially even with the active population that works out a lot or trains a lot. You kind of have to tear down those movements. And I don't like to keep people from not moving, but we do have to kind of move within your own means. So I use a graded exposure, kind of like a red light, green light, yellow light system of okay, can you do this? Does it aggravate the pain? Okay, then let's not do that movement quite yet. Let's kind of scale it down. And then we work through that pattern with them.
I think for people to understand, there's not a movement you have to do.
No.
You don't have to deadlift. You don't have to barbell back squat. You don't have to. You can do, if the goal is to just look a certain way, you can do that 700 different ways. Yeah. Same thing for performance too. There's not one thing you have to be married to. Unless your goal is to be a marathon runner, then yeah, bro, you got to figure out how the fuck you can run. You know what I mean? But short of that, for most of us, it's not the thing.
No.
It's they just want to play the one I talk a lot of shit about this on here. Pickleball becomes the thing because I'll get people in here. I'm generalizing here. Our people, we build it into their day. That's the only way they'll do it because they're not going to do, most of them, I would say 70% won't, 30% will. They're not going to do a dedicated mobility routine every day. They just won't do it. They don't give a shit. Or they do, but they don't. Whatever you spend time doing, you care about. So if you can watch Netflix for 2 hours, you could do mobility, but you're choosing not to, so whatever. But they won't do that. But yet they'll go play, and they get competitive, and they go 0 to 100, and moving in multiple planes. And then not only that, because I'll see non-contact injuries from that essentially, but they're death gripping this fucking paddle for hours, and they only play with one hand. And then they come in, it's man, now I have tennis elbow. Typically, sometimes it's golfers, but more often than not, it's tennis. And that doesn't go away quickly. No. Because I've had it. That's a journey. It sucks.
It's an overuse injury.
Yeah. And then telling them, well, just don't play as much. They don't want to, they go, really, and I'm not a fan of not moving either. And you can still play. but the way that you grip and you can't push on the joint because it's already fucking pissed. It's the tissue above or below. That's the biggest one for us. Like if you see those guys, like is there like a prescription or like is there manual therapies you try to take them through?
Dry needling.
Really?
Yeah, we dry needle it right into that common extensor tendon. It's not the most comfortable, but it works great. Cupping, scraping, and then laser.
And then you tell them like, hey, don't play as much.
Definitely dial it back, but also like work on the forearm flexors.
Yeah.
Like, okay, if the extensors are being overused, well, let's put some load on the opposite. They're antagonists to each other. Move the other tissue.
Yeah, because it's hard to get people to buy in. They just want to play.
At a certain point, you have to have conversations sometimes of like, okay, if we're week 3, 4 in now, we're not seeing any improvement and you've been playing still this whole time, then yeah, let's maybe taper it down a little bit. 1 game a week or 1 session a week, however that looks for you. So we're still getting that movement, but then on the off days, now we're training the tissues around that joint, working on them, getting them looser, getting that inflammation down, then we'll have better results.
And again, I get it, man, because it's like the activity, you get lost in it. There's something magic about play, and I understand all that. But when your fitness, like we call it, when your fitness steals your fitness, when now the thing you're doing is impacting the rest of your life in not a positive way, that tends to be the tough part. Yeah, that's probably the one we see the most part. So I guess if we piggyback on that too, like how important is the overall like mobility piece for these people who come in and like, maybe they come in and work with you, and we can talk about like the prehab versus like kind of rehab stuff where whether you would suggest people to come like on a normal basis to come in and get treatment, just like as how you change your oil, rotate your tires in your car, similar concept, or hey, I'm just going to come once I already have an issue. The way I look at when I go to my dudes, whether I came to you or whoever, you guys are doing like, it's like the dentist. You do like a deep cleaning, all the shit that I can do. You're just doing it at a deeper level, and you can see it from the outside. And you can obviously, like if it was like my external rotators or something, like you can do that. I can't work on those. And it's hard for me to dig into my piriformis. Yeah, I can do it, but it's not the same. But if you work on me for a week and then I don't do shit for the month, and then I come back to you a month later, it'd be like going to the dentist, get your deep clean, but don't brush your teeth for 6 months. Yeah. It's not nearly as effective. So what do you prescribe for people like that in terms of like, hey, here's this you have to do, or do you suggest like, hey, maybe some type of mobility routine, daily, weekly? How do you try to spoon feed it to them?
Yeah. I give everyone a couple mobility drills along with those exercises that I give too. So like a new patient comes in, whatever section of the body or wherever their pain is we're working on, I'm going to give them at their second visit, I'm going to go over everything we went over at the first visit. I've got a nice exercise plan worked out for them. There's usually mobility involved in that. Now, on the flip side of that, like somebody who comes in, maybe they're hypermobile and they've got, like Ehlers-Danlos or something going on where they truly have.
Talk to that to people, because I know sometimes people see things and they think like, oh man, like I got a dude here. Shout out to Mike D. Mike's great. He can do straight side splits like fucking Van Damme, bro.
Yeah.
It's very impressive to see. It is unbelievable. He's hypermobile.
Yeah.
It's not, and I'm not saying he didn't do, martial arts as a kid and train for it. But if you can reach that level of that mastery, you should be more mobile than me in every fucking area of life. Like to do the side splits as a dude is fucking bonkers, man. Like, you know what I'm saying? Like, you know how hard that is. It's insane. And he can do it on a drop of a dime, but he's hypermobile. Yeah. So people, and I would argue it's probably better to have a little more tone than not enough. Yeah. It's probably better to be a little bit tighter than to be too loose, just because like shit can go sideways real quick. So just break that down for like what hypermobility is for people versus the opposite.
Yeah. So hypermobility is like when you can take a joint past your like defined range of motion. So like every joint in the body has what we call like a textbook range of motion that we should be able to move through. If you can go beyond that, that would be hypermobile. The other kind of classification of hypermobile is if you're able to take the joint through that range of motion, and then there's still passively somebody could push on that joint further than it should go. So there's an end range of motion. That's where the adjustments are delivered, is at end range. So there's a a structural end range, and then there's also what we call like a physiologic end range. So the physiologic end range is where the adjustment happens with the chiropractic. And if you can go past that point or too far into the physiologic range, you're hypermobile. Those people don't need to be adjusted. They don't need, mobility. They need stability. And that's where, exercise, targeted, very corrected exercise. And that's typically something that, I'll even refer out to PT for, just because they have a much more detailed approach to like a hypermobility case than even I would. And so I've got PTs that I'll refer that out to. But in the situation like that, like someone sees something on Instagram, like, oh, I'm going to try this mobility drill. They probably don't need that. In fact, it's probably doing more damage than good.
What percentage of people you think that is?
Hypermobile?
Yeah. It's not crazy, is it?
It's not, no. I would say more people are stiff than anything.
For sure. But I've only seen a handful in my whole, I'm sure there's more out there that I wouldn't know.
Yeah.
Like when I see females, I believe it's real. Like they're just like like my wife, right, can just drop into the splits. Like fucking, like it never, like I practice that shit, dude, for 2 years every day and barely can get the right leg in front and the left leg behind. Zero chance this left leg ever, it's the hamstring's too tight.
Yeah.
There's nothing I can do. You could dry needle it for 1,000 fucking years. And she just goes in the living room floor, just like, boom. What is that? But I also like trained forever, and she's a female, and there's that, and she doesn't deadlift as much as me. So there's all those things,
right? And I would say like a female to male, like their hip angle's different,
100%.
The pelvic inlet's different. So like structurally, they are made to move in different ways than men are. So I mean that's an aspect of it too. And I think I would say like of the hypermobile patients I've had over the years, majority are female.
I got one or two here. Yeah, it's crazy to see. And also, I think age range training is real too.
Yeah.
Like what you did as a little kid versus like an adult. And not that you can't get better at mobility, because I had people here. It's crazy because, and you probably agree, dudes on average are way worse than females.
In terms of mobility, yeah.
Yeah. I mean, I have, I probably only have like 2 bad females. Like ever. I've had 2 like bad. Crazy one of them, the most athletic chicks I've ever worked with ever. The worst mobility. Yeah, it's crazy, dude. Yeah. Tightest hamstrings like you'll ever see. Maybe one lady here is worse, but she's gotten better. But freak though, fast, powerful, like just tightest fucking human ever.
Right, and that kind of brings up the question of tonicity versus like hypomobility. Like for an athlete, some people don't need to be super mobile in a joint because they need to create that power. So force versus mobility. Like for someone who's a sprinter, they're probably not gonna be able to do the splits. They don't want to do the splits.
No.
They want quick, fast fire muscles and moving that joint quickly. And so building those joints and how they train is gonna kind of lend to that, what we would consider to be stiff, but maybe not necessarily needs to be worked on stiff because it's a functional stiffness.
One thing that too, like if you're gonna go into competition or even like to a practice, there's a point where you're too loose.
Yeah.
Like when and I know that sounds counterintuitive to people because most people are just stiff as shit and they can always, but I'm talking about people like when I was maybe that age of person, because obviously in my 40s, I'm not as fast sprinting as I was at like prime 22 me. I can still do some prime things, but the speed is not there. Lateral quickness is not, it's just, that's the reality. Like I'm Jordan from the Wizards versus, what I'm saying? Like, the Jordan from 87, which is great, still can play. But when I look at it, my mobility is dramatically better. Because the time I've spent on it, and you just don't have that same like type 2, just boom, boom, boom. That does go quick for people.
Yeah. Which
is interesting. So when you have these guys, obviously they go through like a mobility routine, like they have a practice. We do something here where we tell them like kind of like we have a microdose it essentially.
Yeah.
Where almost like when they're sitting like an every hour on the hour, if you could just get up for a minute, stretch, go through stuff, which we can get people to kind of buy into some of that if they put a timer on their phone, which seems neurotic, I guess. But when you think about your day, like if an alien came down to this planet and was like, oh, you guys just sit in these fucking chairs and stare at these screens for 9 hours a day, but you won't get up and move for a minute every hour.
Yeah.
Like, isn't that kind of bonkers? So at least we can sell them on that. But the other hard part for us is like the SMR, like foam rolling, tissue work. Most people don't like to do it. It's painful. It hurts them. What is your like stance on it, prescription on it? Like, how do you try to integrate into people's lives if you guys do?
Yeah. Case by case approach. I mean, really, like, there's the patients that they're like, yeah, I'll do anything to get rid of this pain. And
Is that what percentage of people you see come in? They're just like fucking hopeless and like, just fix me. Versus like, this kind of bothers me. Can you help me?
hopeless?
Where they've like maybe they've tried 10 different things, or they're just so because like I've had it too where it's like my low back was fucked. Like I couldn't sit down. And I'm like, if you told me to eat shit out of my backyard, dude, I'd have done it. You know what I mean? Like, it's just like, I'm barely putting on my underwear.
Yeah.
Like that type of shit.
We definitely get quite a few. And I think because of the office I'm at right now, Acacia Natural Medicine, like we do a really good job of breaking down, like, you know, what's causing the pain. Like we take the time to go through all these tests, the history, like really get to the bottom of what's going on. And so Dr. Brock and Dr. Byrne, they've kind of built a reputation for themselves of where we get a lot of those patients. Like people, they've tried XYZ things. They come to us now and they're like, I don't know what else to do. Like I'm going to go get surgery at this point. I don't want to.
Is there a good amount of people who come into you and that's where they're at?
Yeah.
And like what's the most common?
Low back.
Really? Yeah. Like they're going to go in and do like fusions or?
Usually like a discectomy, fusion, laminectomy. And they don't do a lot of the laminectomies anymore, but.
And yeah, that's we can go down this rabbit hole too. So there's a huge percentage of people that are told they need to have a surgery, but I think there's an even bigger number that heal like on their own.
Yeah.
I want to say I even just saw this the other fucking day. It's going to bother me because I know I won't be able to find it. Is it on my phone? Oh, God, it's got to be in here somewhere. I just read this the other day. It's going to really bug the shit out of me. Anyways, so they come in. They're like, hey, my only option is surgery unless you can fix me. What percentage of those people actually do you think like go through the surgery versus like which ones you can actually kind of help?
It'd be hard to put a number on it because
they leave you and then they go get it.
They don't necessarily leave, but like, especially okay. Let's back it up. So if someone comes in, they've had this pain for 5+ years, and now they're at this point where
that long,
and that happens,
bro,
dude.
I waited like 3 months. I'm like, I can mobility my way out of it, and I knew I was fucked.
Yeah,
that 5 years is bonkers, bro.
A long time. I mean, especially
with chronic back pain.
Yeah,
dude. Okay, so they wait 5 years.
So let's say they wait any amount of time.
Yeah, a year.
Tissues that are dysfunctional and painful for a year, like you get into this realm of then chronic pain, and that's not something that any chiropractor, PT, you're not going to take that away even in a couple weeks. It's something that's been there for a year. Like that's going to be a slow progress, but as long as you're making progress, and I think that's like getting down to patient communication, like setting clear guidelines with the patient at the beginning of a case like that of like, look, this isn't going to be you hurt your back last weekend on the lake and now we're, getting you out the door and you're going to be better tomorrow.
Yeah.
So we see those too, like weekend warriors threw their back out and they just want to be fixed real quick. Like good results with that just because it's not a long-standing injury. But the chronic pain ones, like setting those clear guidelines of like, this is going to take a long time. This is not going to be a quick fix. And so some people, I think the numbers, if you looked at them, it would be a large amount that probably still end up going with surgery because maybe those guidelines weren't set with the patient of like, we can help, we can maybe prevent you from surgery. There's no absolutes necessarily, but give us the time to do it. And I know that's a hard case to sell to someone that, hey, I've dealt with this pain for a year already. I don't want to deal with it for much longer.
But also, I think they think I'm going to get the surgery and now the pain will go away.
No.
And can we speak on that a little bit?
Yeah. I have a great example. Actually, my aunt, she had a microdiscectomy last year.
And like, so it's your family. Like, I don't know how tight you are with her. Are you like, hey, bro, don't do this?
This was like an emergency one.
Really?
Yeah. I can't remember the full details on it, but she like was leaving work and like stepped down the curb and just like collapsed. Went to the ER. And they're like, oh, you've got like severe like radiculopathy. I can't remember which side, but
really
emergency discectomy. And then fast forward 3 months, she's got drop foot in her leg. She can't hardly move her foot.
And that's what I mean.
Yeah. And so now then she's like, just a month ago, she got a stimulator put in her back.
So do you think, like, obviously you weren't there, like, is that a surgery you needed? Like, did you have to do it?
I think in that case, like, creating that space for the disc and the nerve, probably necessary.
Fuck, man.
But I don't know. I mean, I haven't seen her stuff, but
That's what I get at, where we get people here, they're like, oh, well, my back hurts, I gotta go. I go, bro. And I'm not judging. Like, I don't know. I'm not a doctor. I don't know every case. But we take these drastic steps and not in a realistic there's a book, Think Like a Freak. They talk about lap band. Like, you're going to get this surgery, right? The example they give, they go, what if you tried to puke in a jar and wear it around your neck, and every time you're hungry, you just smelled it? And that's fucking disgusting. He goes, or if you just do like a little paper cuts on your lips, and every time you were hungry, you tried to eat, it was painful. They go, both those things sound fucking crazy, but they're much less invasive than opening up your fucking body and doing a surgery, which, by the way, they break through almost all those anyway.
yeah.
That's what I mean when someone says, well, I'm going to have your spine, first of all. Of all the things, it's not, I don't know if it's the worst thing to work on. It's not one of the best, like, because it's so delicate and you can fuck with so many things. And I've seen positive outcomes too. I'm not saying I haven't, but I've seen a lot of ones where the hospital says they're positive outcomes, but for the patient, they're not. Because, like, what the hospital deems a success or the surgeon does is not what you might deem a success. And I think the idea of I will be pain-free or symptom-free, that's very rare for most people.
Yeah. I mean, I think you have to look at it in terms of quality of life too. Like, how bad was the back pain before surgery? And how bad is it now? Or are you able to do the things you weren't able to do before surgery? And that's hit or miss too.
Well, that's what I'm saying. Like, okay, it hurts, but I'm going to do the surgery. Well, now can you go? First of all, if their goal is like go fucking snowboarding, or like if you're, whatever your thing is, or you're like, hey, I'm into bull riding. Like, well, you probably fucked either way. You know what I mean? But the way that I look at that is, have you done all of the things beforehand to avoid this outcome?
Yeah.
So if I can only use my own example. Okay, so I had L3, L4, L4, L5, L5, S1 herniation, unroofing. Not fun. Sitting in this chair. Try to do it on my own. Couldn't fix it. But I'm like, let me hook up with all my people, do all the things I can do and I'll give it a year. Within 6 months, I'm already like, first of all, with the 3 months after that, I'm like, I'm rocking and rolling. Like, I can do shit. It still bothers me, but within 6 months to a year, it's like perfect. Now it's like nothing bothers me. I'm Bruce Willis from Unbreakable again until I'm not. I go, but no surgery, no anything. I know it took an insane amount of time, a lot of effort, meeting with multiple people. I'm privileged and lucky enough that way where I know the right people and I'm on my phone. But I'm sitting here, I'll do mobility for an hour. And it doesn't got to be straight through. I'm like, but I don't give a fuck. Like, let me make sure everything is aligned, everything is open. Let me do all the things I wasn't doing. So if I go back and I think about it, maybe deadlifting 600 pounds, not that smart. Maybe not stretching my quads enough, not that smart. Maybe not doing hangs after doing fucking 100-pound rucks. You know what I'm saying? Like,
yeah.
All the things. And like when you have this tight anterior chain and you're sitting a certain way and you're working on an app more and you're stressing more and it makes sense to me why it happened. And a great gift on the back end because now I have an experience. But the point was, I'm like, I'm not going to have someone cut me open, bro. That would be the last fucking thing I do. Like, I would kill myself in every way possible to try to fix it beforehand. And I don't know if a lot of people are willing to do that.
No.
Because I know enough people to where I'm like, I don't know if the surgery gets me back to where I was, and I want to be that guy still.
Yeah.
Which is kind of crazy.
Yeah, and I think people have to be willing to do that work if they want to avoid having a surgery. Because discs can, over time, what we call resorb. So those herniations can.
Almost all of them.
Yeah.
Like a huge percentage.
Unless you have a severe one where it's what we call like a sequestration, where that disc material, the nucleus pulposus, is just inside the disc, actually separates and leaves that disc space and travels out laterally.
Who is the, you ever seen him? He's I think his name is like the shirtless dude on Instagram.
Yeah, yeah.
His was like.
His was awful.
Yeah.
Yeah.
He's hypermobile though.
Very.
Yeah. He's a freak.
He's free.
But he was a freak before anyway. Yeah. But it's crazy because he loads, I'm not saying do that, but he loads relatively heavy.
Very heavy.
In all the postures. Mm-hmm. And his was fucked.
Yeah.
Like his was way bigger. It was like, I forget the millimeters, but it was drastically bigger than the ones I had.
It was larger. I think I remember reading his case and like he even had like drop foot and stuff going on to where like
but built it back up.
Yeah.
Now, again, everybody's different. I understand that. I go, but that's, again, same thing. Someone who's, I think those stories need to be out there too. That's why I always tell people, I'm like, well, here's what I did. Now, maybe not for you, but I'd rather do that then. Because now I'm back to everything I was. I can do things smarter now because I don't have to do the same dumb shit I used to do.
A big part of it is too, like, we live in such a fast society now where everyone wants like these immediate results. And it's like there are really good results with disc injuries, with PT, chiropractic, and doing exercise, like very correct, like guided corrective exercises to get those discs to heal. It's not a quick fix. It's not going to be one weekend and you're noticing your difference.
Well, no, for one, the injury didn't happen quickly.
No.
Even if it did. Because mine, like I sat in this chair, fucking the Holy Spirit entered my body, and I'm like, if I don't get up, I'm fucked, dude. I'm like, I can't say anything because Monica's going to think I'm a pussy. And so I'm like, let me just get up. Because I'm like, let me go box pigeon stretch. I'm like trying to get out of it. And it was like, okay, maybe it'll be a little bit better. I woke up the next day and it was like fucking seized. I mean, it was putting on underwear, bro, would have been a fucking sight. The weird thing was I could still like do some exercise. Like I could still do pull-ups and farmer's carries. I couldn't hinge at all. To do like the McKinsey stretches, zero fucking chance, bro.
Oh, okay.
There was no way. I could go forward past the point of like, but I couldn't come back up. Anyways, like that's like kind of what I went through. And so like let me go through all the things. But the point is, even if you have a surgery, right? Like you still have to do the other stuff anyway.
Yeah.
Like that's, I guess what I'm getting at is like even family members of ours who are like, well, my knees are shit. Motherfucker, you don't train. You haven't done any mobility. You do no tissue work. You won't go to a person who can actually see you because your insurance doesn't cover it. And I'm not talking shit here. And I don't know everybody. I don't know. I can't read the scans. I don't know. But even if you do the surgeries, guys, whether it's back, knees, hips, shoulders, all the things I'm saying, all of the tissue work, all the PT, all the rehab, all the mobility, you have to do that any fucking way.
Yeah. You're going to do it afterwards.
Yeah.
So why not try and do it before the surgery? And if you get results, great, continue down that path. It may not be 100%, but if you see that positive improvement, work towards your progress, your goals, whatever it is that you want to do, then you could potentially put that surgery off or not do it at all.
And that's what I think too for people, if you ask like, what is success? If I have a surgery, like what is the success? Like what does it look like on the back end for me? They can't really answer that for you. They don't really know. Because it's like, what if I lose range of motion? What if I lose strength? What if I still am irritated here? And I think there is probably good surgeons out there for people who aren't great. They probably have you started even before you go in.
Oh, yeah. I would say most orthopedic and like neurological surgeons nowadays, they are really good at saying, hey, have you exhausted all these other things?
Before we cut you
Before we consider cutting. Now, that's not to say that there aren't severe cases where like cauda equina syndrome, which is where you have like a central disc protrusion that is pushing on like where your spinal cord terminates and turns into like your sacral plexus. If that is getting impinged, I mean, you've got like, we always ask patients this question, like, do you have any numbness or tingling in your genital area? Because it'll affect your genitals. Bro, those are severe cases.
I think you'd fucking know, right?
You'd be surprised though.
Dog. If my dick was numb? Yeah, I would know. That would be rough, bro. Dude.
But that's the thing. Like we have to ask people that because
so if they're at that point, they're fucked.
It's like an emergency surgery.
No shit.
And that's like the one that you don't mess around with.
How does that? That's what luck of the draw. It just happens.
Those are rare cases.
But that happens to people.
It does happen,
dude. The way I think, man, every day. Like, I'm just grateful that I can do anything. So I try not to be a little bit a bitch, obviously. But it is, when you think about your body, right, because you know enough, too, that it works in general.
Yeah.
Like, how many things can go wrong on your car? I think that every day my car drives here, I'm like, this is great. The fact that this fucking thing made it here again. Like, because all the things that can go wrong just fuck it up.
Yeah.
Your body's the same way. Like, even little things that you don't think matter. Like, you break your toe. I did it the other day. As dumb as it is, I'm like, I was actually walking with my stupid fucking, I was at home actually, like trying to grab, my kid was crying. I went up and kicked the fucking couch, so black, this thing is crushed. And I can still do everything, But it's like, well, now I can't like couch stretch the way I normally do because I can't sit back on my heel. Just dumb shit.
Yeah.
And that's like one little piece that doesn't matter, but it does matter. And so you start to look at like in your spine, not that it's a little dumb thing. I go, but there's so many nerve endings in there. And it's like, once it hits one thing, now it's shooting down my leg into my foot. Now I have this chronic problem, which is kind of wild.
Yeah.
Yeah, it's a weird thing, man. It's a miracle it works at all.
Yeah.
So if we talk about that, scans, right, in general, I think people, whether it's, what do you guys do in terms of, to take a deeper look, whether it's x-rays and MRIs for people, and then kind of that process, and then what does that mean to you when you guys look at it versus like what it means to the patient?
Yeah. So with imaging, we don't get imaging on every patient. I mean, it's not absolutely necessary. Cases where we want to rule out certain conditions for whatever region of the body, we'll start with an x-ray. Unless someone has neurological symptoms, so like numbness, tingling, weakness into arms or leg, then we can push towards an MRI. And then it also depends on like if the patients say, hey, we can just go with a cash route with the imaging center, we can jump straight to that MRI. If they want to run it through their insurance, which we can do, even though we don't treat on their insurance, you can still push an image through on insurance.
Dude, it's so cheap to pay cash.
It is. So much cheaper.
I got sick insurance, and I think it was to pay cash. I want to say it was like $250
I
cash.
paid more for my knee MRI going through my insurance than I would have paid out of pocket.
Yeah.
And I didn't know.
Yeah, because I called and they're like, yeah, if you just pay cash, it's like $250. But if you use your insurance, it's like, I don't know, $700.
Yeah.
And I'm like, that seems ass backwards.
Yeah.
Because what here in the Valley, what is it, the Smile places?
Smile, Simon Med, and then there's, what's the hospital system?
Smile's the one that
Smile, okay, yeah.
it's the biggest one that we use.
We use Smile and Simon Med for the most part, but then
Like Banner and them.
Banner, they have their own imaging centers too.
Well, I didn't know either, like, 'cause my wife's had a couple, and I always thought she was being dramatic when she'd freak out in there. And then I did one, and I'm like, oh, sorry. I get it. Because I almost quit. I did, but I almost hit the panic button. I
fell asleep in mine.
Really?
Yeah.
But bro, I was unprepared. I was not good. Yeah, dude, it's the worst, dog. I went in there, eyes open, like, oh, this is going to be fine. And then it's like within 10 seconds, my heart rate was like 200 through my fucking neck. And I'm like, oh, dog, like, don't quit, bro. That was bad. Yeah, I was like, I had closed my eyes. I'm like breathing, like doing practicing like all this box breathing shit. And I'm like, I barely made it.
Yeah.
It's hot as fuck in there too.
It does get warm.
Yeah, because I got in the room and I'm like, why is it so cold in this room? And then I got in there and I'm like, oh, I get it now. Yeah, that shit sucks. Anyways, you do both of those for people, and then you get the scans, and then you can kind of pinpoint the treatment or like what the route you go.
Yeah, I mean, the biggest thing that I like to emphasize is we're treating the patient, we're not treating the image. Because a lot of times we'll get x-rays back, or people will come in already with images they've got somewhere else. And it'll show, X, Y, Z findings.
Like, how old do you kind of accept the images, right? Like, the way I think of it is, and here's how I'll frame it. Like, you have an MRI from 2 years ago. Mm-hmm. Here we go. Worthless, in my opinion. Not worthless, but it's a snapshot in time.
Yep.
And I think what we do is we get married to the diagnosis of things. We get married to the image. So if I see it, oh, I'm fucked. I have herniation. Oh, this is who I am. No, it's not. It's just who you are today. And I'll let you talk on this too. Kelly Surratt told me this a long time ago. He's like, dude, if we scanned all of you guys in the room, it was our Reebok team at the time. He's like, if we scanned all of you guys and we looked at your knees and your shoulders and your back, they're all people like me. He's like, you're all fucked.
Yeah.
None of you are perfect, but you're walking around and you feel fine. And I think that's when people see that, they tend to freak out a little bit.
Yeah.
So when they come to you, like, what do you have, like a window, or do you say, hey, we need a newer image or versus an older one?
It just depends on the person too in the case. Because like, if they had an MRI 2 years ago that showed, okay, small herniation, and back then they were having, symptoms on the leg, but now 2 years fast forward, they have some minor low back pain. They don't have symptoms down the leg anymore. Is it really necessary to get that image done?
Probably not.
No. We know there's a herniation. It may or may not be there still, right? But they're having less symptoms now, so there's really no need to get that MRI.
And you have a general idea.
Yeah, we have a general idea. We can do a thorough exam and say, okay, is it warranted? Do we really need to go that route? Now, on the flip side, 2 years MRI, and now they come in and they are worse. Yeah, we should get an updated MRI.
How often do you guys, like, if you see someone and I guess it depends on the person, like if they can articulate what's going on, you can talk to them, they understand basic movement. Can you guess like what their thing is? Like how close do you guys get? Pretty close.
Throughout the history, like I'm asking a lot of questions about, their whole condition of when it started, how it got here, what they've done previously. Usually, if you take a good enough history in your head before you even start doing the exam, you've kind of got a working diagnosis list in your head of like, okay, I'm thinking it could be this. It could also be this or this. So we're going to hit these different orthopedic tests to make sure we can rule in or out those 3 conditions. And then vice versa with okay, I think it's one of these big scary ones. Well, now we're hitting imaging. We're going to get that x-ray. We're going to find out for sure if it is this or that. So yeah, throughout the process of the history taken, like you can kind of get to a point where, okay, yeah, I think it could be this.
Yeah, because I remember like I did, like Russ Teams at his place did like this decomp stuff with him. I had him on the podcast, and then I let my back hurt at the same time, so divine intervention. But he was like, I guess it's because what I would tell him, I'd go in, I'm like, it doesn't hurt here, and I take all the notes. So I'm that psychopath who comes in with the full like, I can do these lifts, I can do these like patterns and postures and patterns, and those ones bug me, these ones don't. And he's like, I'd guess it's L3, L4. And so I go, he's like, but let's just do it just to make sure so we can pinpoint it. I'm like, he's like, it was pretty much spot on.
Yeah.
Which is super cool, I guess. It would have been great to not do the MRI and just have him just go with that. I go, but I get it to get a picture of what you do. And that's the big thing I would take away from that for anybody. Like, it's just what it shows today.
Yeah.
It's not a terminal diagnosis. And I think people think that sometimes.
Well, then to kind of piggyback off what you were saying with the Reebok guys, there's a ton of studies out there now where if you took 100 people off the sidewalk and you did an MRI on 100 people, 80% of people are going to have what we would consider like at least a disc bulge. Of that 80%, who has symptoms?
Pretty small.
Pretty few.
Which is crazy.
Yeah. So that's where like sometimes imaging is also detrimental.
Because it can fuck you up.
Because then people can get caught up on, I have degenerative disc disease.
Can you break that down? Because I'll hear people say, they'll go in and they'll say that, and it sounds on the surface like catastrophic, right? Mm-hmm. Like, oh, I'm fucked. Like, that's how they just frame it to me. I don't know if they are, but that's kind of how, and people say, oh, I have a disc bulge, like I can't do anything. I'm like, well, I don't know if you can or can't because I don't know your pain tolerance and what you live in. But sometimes people hear that and they adopt this belief system of...
It becomes who they are.
Yeah.
Yeah. I mean, a disc bulge is just that outer fibrous tissue starts to bulge a little bit. That nucleus pulposus in the middle starts to kind of push out a little bit. It's not a true herniation necessarily. It can turn into one, certainly. But it really is only going to cause like symptoms if it's pressing on a nerve or if it's irritating the nerves around that innervate that whole space itself. Because you've got nerves that leave the spinal cord and go out to other parts of the body, but then you also have small little nerve endings around the disc and the joint of the spine that it can irritate as well. And then, what was the other part?
Like the degenerative disc disease that people like, how common is that? And do most people even know they have it?
It's fairly common. I would say, I don't like to say anything's normal in terms of dysfunction, but it is a typical pattern we see with aging. So, I mean,
what's the tipping point? 30, 40?
I think it just depends on your overall health and what you've done.
Like, what if you were just like a savage? You just beat the fuck out of yourself. You're probably there.
Younger, yeah.
Welcome. Here we are.
But, I mean, I've also seen people who are in their 20s that on their MRI report it says they've got mild DDD already.
And sometimes it's just like genetics, luck of the draw.
Absolutely.
But how catastrophic is it if somebody hears that? I think people hear that like, oh, like I got to take it easy.
It's really, I mean, it can be very non-catastrophic, but then it can also get to a point where it is bad. Because DDD, we're looking at that disc space. So between L4 and L5, that disc itself, if that disc space starts to decrease, so that disc is decreasing in size, you've got hardening or what we call sclerosis of the end plates on L4 and the top one on L5. So you've got arthritis taking place as well. That disc space starts to narrow. that disc is what's holding the vertebrae apart and allowing that nerve to exit freely on both sides to your leg. And so if that disc space gets to a point where it is like that disc space is gone, that would be like a severe case of DDD.
Yep.
Then that is catastrophic because now you've got bilateral compression of that L5 nerve or L4 nerve. Sorry.
And so, and you touch on like the arthritis piece. Like, what is it's just, hey, father time, luck of the draw. Like, how do you fight? How are you fighting this?
Yeah. Again, that's kind of a good snapshot picture of like your overall health. I mean, arthritis can take place on anybody. I have arthritis in my knees at 27 when I had knee surgery.
Do they hurt?
No.
What knee surgery did you have?
I had ACL reconstruction last year.
Really?
Yeah.
How did you tear that?
Started on the dirt bike, hyperextension injury.
There we go.
Rehabbed it, and then I thought I was good to go, and wakeboarding dislocated my knee.
Oof. Yeah. Those are bad. The knee dislocate. I had a lady here. She's not back yet. Trampoline, but didn't fall off the trampoline. Came down, broke. Yeah. Tib broke.
Yeah. So my actual
knee dislocation for her too.
Yeah.
And ACL tear.
Yeah.
All three.
Yeah. So I was wakeboarding, came down, landed on the downside of the wave, like just perfectly. And I think that knee was already just still weak from the previous injury.
And you knew it.
And as soon as I landed, it was just like, and it reset on its own. And I was too scared to look at it because what it felt like is my tibia was going to be sticking straight out.
You hear it, feel it?
Oh, I felt it.
Yeah.
It was the worst pain I've ever
And you're just laying in the water.
Screaming.
You're like, fuck. God, dude.
And I knew right then. I was like, yep, everything's torn. MRI.
When was that?
That was September of 2023.
Oof. So what is that rehab, like 6 months, 7 months?
It's 9 months to a year, but we sped it up pretty good.
You can do stuff.
Oh,
like,
yeah.
Yeah.
Yeah. I mean,
the rehab's forever is what I mean. But like within, I mean, shit, I remember like, you're way younger than me. Like Willis McGahee got his pushback in that 2001 Hurricanes Ohio State football game. 6 months later, he's back squatting 225.
Yeah. So I mean, kind of back to what you're saying, the guy with no ACLs. I mean, I got lucky, and I've always had strong legs, and so I went in. It hurt like hell for a week probably, and then I went in, saw the surgeon, got an MRI. We confirmed that. I mean, he did the test, and he was like, "I think you have torn ACL." I was like, "Yeah, I'm pretty sure I do too." Got the MRI. It was just jacked, both meniscus, ACL, and fractures, tibia and femur.
No shit.
Yeah.
Dude, you ate it good, bro.
Oh, yeah. And then about a week after the injury happened, though, I was like, I had no pain. I was still working, treating patients every day, working out at the gym, golfing,
walking,
running.
Gingerly.
No.
Fine.
But if I squatted past 90 degrees, it would start to dislocate. So I didn't do that.
Bro.
But I pushed it out because I was like, I own a business. Like, I can't take time off right now. So I pushed it out 4 months. Went in for surgery, and I had just played golf the day before, and the surgeon's like, so your pain's still 0? And I was like, dude, I shot 82 yesterday, best round I've played in a while.
That's crazy.
He's like, I hate to tell you this, but you're going to be in a lot of pain after surgery.
Oh, was it too?
Oh, yeah. I mean, they took part of my own tendon, my quad tendon, and that's what they strung it through for the new ACL.
Those are probably the three worst, right? Achilles, quad tendon, and then ACL. Mm-hmm. Probably in that order.
Pec, too. I had a buddy.
Yeah, I've seen that.
Yeah.
A buddy of mine, Ben, with Sean, you know him, going downstairs, slipped a little bit. He's now again, Ben's like 6'9", maybe. I'm being generous, 3 bills. Okay. So reaches back. Yeah, gross. Yeah. The pec's fucking bad.
Yeah, I think
all the ruptures of biceps are bad. It's all bad.
Yeah, well, have you seen that one? It balls up
in real. I've seen 2 in person.
That's nuts.
Yeah, those are hard to watch, dude.
Yeah,
but the ACL, it sucks. It all sucks. That one's a bad one too.
Yeah, but I got lucky because I had my legs were in good shape before surgery, so recovery was a lot easier too. And that kind of speaks to the whole rehab thing we were talking about earlier.
Well, you train. You're younger too.
Yeah, if
super
you train,
helpful.
I mean. Different aunt of mine, she had ACL like 2 months before me, and I was 6 months ahead of her in recovery.
Well, for a lot of people too, if you're older and you're not in shape, like that stuff can bury you.
Oh yeah, like
permanently. What did he? Who shared that, Chris? The break your hip shit. The people who are 50 break their hip, like 40% are dead in like like a year.
Yeah.
50, dude.
Yeah.
I'm gonna be 42.
If you don't get treated, it's 70%.
Dude, that's nuts, man.
Yeah. Well, because it changes how you move, and then everything else just starts to decline. Like bed rest and retirement, it kills people.
Well, yeah. Well, you watch I say this. I get this example on here a million times. So sorry, you guys are annoyed. But it's that the regression you watch. And I always say, like, when you see an old guy, my neighbor's 2 doors down. He's 100, still drives his own car.
Yeah.
Dude's a savage. He is what I would try to be. Like, obviously, at that point, like, give me all the fucking drugs, dude, because I want to be jacked as I can. I go, but you're still 100, so you're still weak. But like, I like to be like Stallone. Like, anyways, when you see people who go from like a walker to a cane, there's like walking to a cane to a walker to a wheelchair to bedridden. It's that regression a lot of times happens quickly, and they skip steps. So like, you go from walking to break your hip, and now it's like if you're already weak and frail, or you are like, severely overweight, to do all that rehab work with either no muscle tissue or just too much load on the body, it's a huge task.
Yeah.
And the older you get, I know people don't like this, it gets harder. You're not, because you were what, 27, 6 at the time?
27, yeah.
Yeah, that sucks too, because you're young. I go, but the benefit is you are young.
Yeah.
So to do that at 57, do you still wakeboard now?
No.
You're done.
I'm scared now.
Retired. Like forever?
I'll surf. I'll wake
That's
surf.
way safer.
Yeah. My fear now is like having my feet strapped into the wakeboard. I'm going to snowboard this year. I took last year off. I didn't do it because I was like still just But I want to take my son snowboarding. So
I told my wife I'm done. I retired from all that like a long time ago. She loves it. I don't like the cold or the snow, so I could give a fuck. And dude, and honestly, man, like I grew up in the Midwest too, so it's like you would go wakeboard, kneeboard on the Mississippi, which is disgusting. But when you hit water, dude, hard, it's like hitting fucking concrete.
I would rather hit water than snow, though.
100%. I go, but it does it's damage.
Oh, yeah.
And it's the first time like where I'm the age where I look at stuff now and I'm like, yeah, I'm not going to come back from that. You know what I'm saying? Like I remember we're watching like it was like Vikings Detroit play. My mom lived in Detroit for like 20 years before she moved here. Man, the Vikings are playing, and I forget who it was. He goes, it's a goal line. Detroit's running back, full flips in the end zone, lands on his ass, gets up, high five, totally fine. And my mom's like, how does he do that? I'm like, he's 20 years old. And I watched it for the first time, and I'm like, oh yeah, I can't do that anymore.
Yeah.
Like if I was to do that, I don't think I would die, but I would be fucked up probably. Yeah. Like I don't think I'm to the point where I'd break something, but it would hurt.
You would feel it for a few days.
For days. Yeah. Where before, when I'm 25, like nothing, bro. That's how I look at like wakeboarding, snowboarding, those things. I don't love it enough because the injury is going to be catastrophic if I get one. Like our friend, the anesthesiologist, she was skiing Colorado, quad tendon, and she had to get in the fucking little thing and zoomed her down the hill because she couldn't.
Patrol?
Yeah, so she had to be in the little. She did a video of it on Instagram. It's actually pretty funny. She's in the little bobsled thing, and they got to take her down.
Yeah.
Which again, if you love it, that's cool. But your feet are strapped in, and if it goes sideways, if you take it easy, and you can govern yourself, you're skilled enough, and you love it, then do it. But that is a catastrophic thing.
Yeah.
Yeah, interesting.
I have a hard time though with I'm a bit of an adrenaline junkie. I just grew up doing all that stuff, and so anytime we do that, I'm just always like, I want to do the jumps, I want to do all that still. So that's where it's a tough pill to swallow. Of
the acceptance of it.
I can't do that anymore. Like I have kids and I have a job, and I'm not 21 anymore.
Well, no, because how old are your kids?
4.5 and 2.
Yeah, dog. Because imagine you're in a boot now, or you're in a full. Or if it's a quad tendon, you're in a full. It's your full leg. It's not just a boot. Your ACL was too.
Oh, I was in I mean, that recovery it's rough.
With 2 little kids.
2 little kids, yeah.
You're like a bag of shit.
Yeah, I felt terrible.
Your wife's probably like, fuck you, dude.
Oh, she's already said, she's like, if you have another knee surgery, she's like, I'm just going to send you home to your mom.
Yeah, because it's like you're like a baby.
Yeah.
You can't, because I got a little kid, everything is, they need something all the time. And it's reach down, pick them up. You have to be mobile.
And for 2 weeks, I was not allowed to weight bear as part of the surgery recovery.
Yeah, dude, but it's hard because if you do love, I don't play sports anymore, but we would play basketball still once a year with all our homies, and we all played sports in college, baseball, basketball, football, you name it. We're all competitive, but we would show up and I'd be like, I'm just going to take it easy. Within like 10 minutes, bro, I'm fucking back to it. And it's like, by the end of the day, like I've torn my fucking calf. I can't walk for 3 days because you are that person.
Yeah.
Like in here, your brain will never change. No. Now, again, you might be Jordan from the Wizards physically, but in your head, you're still the guy.
Yeah.
So I'll be interested to see like how you go, like if you snowboard and you can just like do like the weak ass version of it.
My biggest thing I keep telling myself now is I just want to stay doing the things I like to do just to pass them off to my kids.
For sure.
And then once they get to a point where they've got it figured out, then I feel like I can taper it back.
But if you do it like Heather, like they go, obviously, I don't know I know the mountain ranges if I was saw them in person. Like she goes skiing with their dad. He's 70.
Yeah.
He'll still ski. Not super strong. Doesn't have great mobility. But dude will still put on skis and go. That's super fucking impressive.
Yeah.
No, obviously, I don't think he does nearly the same dumb shit he used to do. So if you can do that.
That's what I need to work on.
Yeah.
Just not doing too much.
It's hard because you're not like, yeah, I get it, man. It's hard to turn off if you either have it or you don't.
It wasn't until I hurt my knee that I was like, okay, I'm not invincible.
But like the way I look at that too, like even for my own stuff, like that I've like the injuries I've had, it does make you better at your job. For one, dramatically. You can relate to people on a better scale. You've done the rehab. You know how much it sucks. You can speak to it. Same thing for me here. I go, but also I think like maybe that happens to save me from something super fucking dumb. That's the way I have to look at it. Because like that rehab for you, same thing. It took me about a year to get back to perfect. And after like, when you can't put underwear on or you can't bend down or move your leg, it fucking sucks, dude. Yeah. Especially after a couple months, you're like, okay, whether you believe in God or the universe or unicorn tears, whatever it is, you're like, I get it. I get the fucking lesson. But I wouldn't have got it. If it only would have took me 3 months to get back, I'd have been back on my same dumb shit. Like, dude, we can still deadlift fucking 600 pounds. Fuck it. You know what I'm saying? Like, now that I know that, I'm like, for one, what is the point? Nobody cares. It's an ego thing for me because the rest of the world doesn't give a fuck. And 2, if my goal is just to be strong and like have, good hamstrings and glutes and like, I can do that a million different ways. Yeah. It's just, I do think the same thing. Like I still have the vanity piece of, I want to be able to dunk a basketball, so I still go out and do it. But now every time I leave the ground, I'm like, is this the last time?
Yeah.
Not the last time I just dunk because that will come too sooner than later. But it's, if I leave the ground, am I going to come back to the earth in all the same pieces? And I never used to think that.
Yeah.
Because I'm like, I don't want to. The Achilles would be fucking rough, bro. You know who Stacy Barber is? She runs Physio Fix here. She's a great follow on Instagram. She's a gangster. She's been on the pod a couple times. But she filmed hers doing the warp wall. And she's a freak. I've been talking like freak athlete, very strong, very like gymnast, insane. And obviously has all the technical knowledge. She's great. But yeah, she filmed it herself. Just for like Instagram because we film everything now. Yeah, going up the warp wall, boom, boom, takes a plant, and you can see it just, and then slides back down. That's my fear of like dead sprinting, or because to get off the earth, I have to try. So it's an explosive movement. Yeah. So I do think about it.
Well, that's a big one. We just did a lecture at a gym the other day about foot and ankle issues, and I talked about Achilles ruptures.
Which in the NBA, they're crazy high.
It's super high right now.
Why is that though?
I think it's a lot to do with just like not enough eccentric control for the gastroc and soleus.
I mean, they don't practice like they used to for one. So I think there's that.
And everyone wants to shoot a 3 now. So they're not driving in as hard. They're not doing that stuff. I think the other big thing is like tissue capacity versus tissue load. Like if you're not loading that tissue under that lengthened position, so eccentric, then when you go to push off, in that plantar flexed position, you're not going to get. It's going to give.
It is crazy like how many. Well, again, like, and they are the dudes are
way more common now.
The dudes are bigger. The dudes are faster. They play so much too. The volume is so high. Because like Ben Bruno trained Tyrese Halliburton, like he's his trainer, and Ben's the fucking shit, man. But to see that, like his was the worst because it's the most recent. But like KD's was bad, and you can watch him in real time, so you can see it just snap and go up. It's interesting to see like those way more. I don't remember them as a kid, I'm sure they happened in the NBA. I just don't remember them like being a thing.
Yeah.
Like I couldn't name you 5 guys. Like I couldn't name you Karl Malone, like tore his Achilles, or Charles Barkley or whatever. Yeah, that's a tough one, man.
I think there's a lot that goes into like why there's an uptick in that. I don't know exactly what it is. I think a lot of it has to do with like tissue load, tissue capacity, and then also recovery.
Yeah, it's and that's a shit. It's just a crazy one to see. Yeah. And they're the best guys. Like they're just the best. They're the freak. I mean, NFL and NBA, you know, you can argue either one. Like just the freak of freaks. But that's one that where you're done. Like you can't.
Season's over.
You can't move your foot.
Yeah.
The fact that like Kobe went out there and shot free throws, like because I don't think people get it. Like when they squeeze your, I watched a buddy do his. He was doing TRX, not a TRX. I think he had a TRX hookup with the harness on a sled and just doing sled sprints. And then was like one of the last ones, Achilles just goes, and they go down. And you squeeze his calf, and it's dead. Move. Yeah. And I'm like, fuck.
Thompson's test. That's what that is.
Yeah, that's. And again, I had a buddy too. Here's the crazy part. So he does mobility. It's like us. He does mobility all the time. He does mobility before he's playing sand volleyball. Nobody fucking does that. Like he's getting loose. No one does it. Goes up, Achilles. Thought someone like kicked him in the back of the leg, and just dead right there. Yeah. I'm like, fuck, man. That's like it's not my greatest fear, but it's one of them.
Yeah. One of my buddies from chiropractic school, he lives up in Saskatoon, Saskatchewan.
Yeah.
I want to say it was like a year after we graduated. He's got his own practice up there. He tore his Achilles. I can't remember if it was playing flag football or soccer. And he said it was the same exact thing. I felt like someone kicked him from behind.
Yeah.
That's what they teach you in school about that condition. Is like, oh, they'll report like it felt like someone kicked them from behind. He's like, it was exactly like that.
Because you pretty much know.
Yeah.
Yeah, that's a fucking...
Yeah. There's a few injuries where like as soon as you do something, it's like, you know.
Yeah,
usually it's ACL, Achilles,
and
bicep.
The ruptures, yeah.
Yeah.
Because you see them, pecs I've seen, biceps I've seen. I've never seen the or like the like when you like hamstring full pull.
Yeah.
Like grade 2 and probably up.
You can hear those too.
Yeah, mine felt like someone shot me in the back of my hamstring. It went from like sprinting to like fuck, and then I can't touch my toes for like that was bad too. I've never seen the lat in person.
Okay.
But I've seen it on video.
Yeah.
Where it's just
that's impressive to
because
rupture that one.
It's a big fucking muscle, dude.
Right, it's huge.
Yeah, deadlifting mostly is where I'd see it. Or the guys will do. I've seen bicep ruptures on like where they try to do like levers, just like pull ups. Mm-hmm. Those two. But again, you can't live scared either.
Like preacher curls too.
Yeah.
That
which doesn't. It's weird because the load is. But again, you're at the weakest point. Am I still going to do them? For sure. Yeah. But it's not like I'm not going to bench press, but I do actively think about it. And I'm like, I don't think it's, again, just trying to be stupid. But again, sometimes like with the Achilles stuff too, even the NBA guys, sometimes it just is, man.
Yeah.
It's just wear and tear, whether that's fraying or cumulative damage over time. And then it's just like this perfect storm of like, we go to put all this force. Because if you think about it, like muscles wise, like, inch for inch or like pound for pound, your soleus is probably like the strongest, or at least the most force you can put on. So I would imagine
most force.
And then you take like the Achilles is the strongest tendon.
It's the largest tendon in the body too.
Yeah, like it's got to be the strongest by far.
Yeah, and thickest too.
Yeah, well that's what I mean. Like for that thing to go, fuck, dude. All right, we can talk about that all day. Let me do these last two. I'll get you out of here.
Okay.
Like the most. I guess is the most common thing you see with the average people. Is it like low back in like upper back, shoulder stuff, or hip stuff, or what is it?
Yeah, I mean, a lot of it is like neck pain, mid back, low back, hips.
And the neck stuff is from just probably posture, like staring at the phone all day.
Posture, strains too. I mean, car accident cases, you get that whiplash.
Oh yeah.
So the one thing that is really hard to understand for necks too is like people say, "Oh, I slept wrong." And it's like, well, did you sleep wrong, or were you just already tight before? Again, camel or straw that rode the camel's back, right?
Because they wake up and it's
yes. But
they can.
realistically, they probably were already sore and tight the day before and didn't realize it.
I will say that I do think that's a thing where if I would look back on anything that I've ever had, did I ignore shit? For sure.
Yeah.
I'm to the age now where the little things that used to bug me that would just go away now don't go away. And the things I used to ignore now I'm like, oh, that's a sign of I don't need to do this today, or I can do something different, or we need to get this to a place where it feels good before I can load it up.
Yeah.
And I don't think a lot of people take the time to do that.
No.
Or like, you know what I mean? Like when I've had it too. Rarely, knock on wood, I've not really had any like cervical T-spine stuff ever. But you know, you'll get some, it's usually tissue related. Just because there's so much, dude, between your shoulder girdle on the backside, there is so much shit back there.
Much.
And if you take like, I do say for what it's worth, like the S hooks, like the cheapest, dumbest, easiest tool.
Lacrosse ball.
Oh, dude, shit hurts.
Yeah.
Bad.
But it works.
But if you take those, like you can dig into a lot of stuff. But I've had it where I would turn my head and it's like the most painful thing ever. Most of the time for me, it's anywhere through here.
Yeah.
And if I can get that tissue and you find a spot or two of shit, that typically goes away. And I think sometimes people feel that and they're like, well, let me not move at all. And then it just exacerbates the problem. So yeah, I guess that makes sense. So neck stuff, low back stuff, hip stuff ever with you guys?
Yeah. Yeah. See a lot of hips.
But again, if your low back is tight, your hips are probably tight.
Yeah.
If you can get the hips loose, the low back can usually be loose. Because I don't think people understand that
The connection.
they are one and the same.
Yeah.
I really never meet people where one is great and the other one's shit.
No.
They're kind of all married to each other.
Yeah. The lower half of the body is interesting too, because like knee pain, knees, unless you have an injury to the knee or you've got like some serious degeneration going on, your knee pain is usually from your feet, your hips, or your low back. Knee is a very stable one. It only has 2 degrees of motion, really, 3 if you count rotation.
It just sucks because it's stuck between the hip and the ankle.
Right. It's always the guy. It's like it's the fall guy, right?
Yeah.
He's never the one causing issues, but he's got the issues.
Well, no, and I'll say that because we have, and again, I don't know everybody's stuff, and I don't know how catastrophic like arthritis is at what level and what that looks like as a surgeon, or if it's a blanket statement, or if it's a real thing, or whatever. And I don't know anyone's pain tolerance, but and maybe you speak on this. I've seen people do knee replacements. To me, it sounds fucking awful. The hips don't sound nearly as bad. It seems like the recovery is much better for people. But if someone is like, you need to replace your knees, that seems like a fucking journey and a half to do. And also, I wonder how much time people have taken in to make sure, like, not just the overall quads, VMOs, calves, tibs, hamstrings, all those things can be perfect before the path. Because I do think the knee replacement sounds rough.
Yeah. My mother-in-law just had one on July 1st.
How is she doing?
Not walking still. She's got a walker, but, I mean, a lot of pain.
The hip is better, right?
Yeah.
I mean, it's ball and socket. It seems like they're a lot better at it. Because the knee, and how long does that last?
Everyone's different. It also, I mean, it depends on your activity level after the replacement.
Well, yeah, because like
I have patients who have had knee replacements and they're back to golf and playing tennis and like super active. Other people, it sidelines them. They never get back to full activity. But again, that comes down to rehab.
You still have to do.
Where were they at before surgery?
Yeah.
Or what was their end goal with getting the surgery?
So like, what if somebody? I guess it depends on the stage, but they're like, hey man, let's say they haven't really tried shit. They just been kind of a lazy American for the most part. And they're like, yeah, I went in and the surgeon says I need to replace both knees. But they've done no strength training. They've done no tissue work. They've done nothing. How would you approach that person?
Yeah. Right off the get-go, I'm going to get them on an exercise program, get them moving, and just see if we can build up that tissue around the knee. Because there's a very good chance that, if depending on the level of arthritis in their knee or what's going on, what's pushing them towards that knee surgery, if we get that tissue in better condition that surrounds the knee, that affects the knee, they may not need the surgery.
And you're talking like what? Some type of just strength training protocol?
It doesn't even have to be anything crazy. I mean, it could be heel glides at home.
Yeah.
Because if this is someone who maybe they're, in their 70s, they're retired, their activity level is not that high, but they have pain going up and down stairs. They can't get in and out of the bathtub or getting off the toilets hard.
Yeah.
It's like, okay, well, let's just work on the hamstrings and quads for a few weeks. Nothing crazy. We're not squatting, but if we can just do some terminal knee extensions with a band or heel glides and get that tissue a little bit better, does that affect your pain at all? If it does, then I would say don't do the surgery.
Like you mix that with some type of mobility routine.
Yeah.
Some type of tissue work. Like when they come in for you guys, whether it even be just rolling it. Because I do think there is people out there who they're severely tight. They're limited range of motion. They don't move. They strength train. And when I say strength train, I mean anything that's a load relatively close to failure. That can be body weight for most people. And when you're talking about like terminal knee extension, like just literally how you would step down fucking stairs.
Yeah.
Like whether that be on an incline or a flat surface or you name it, most people aren't doing that for multiple reps.
No.
Like, and yet, I'll go in and that's, I guess that's my point is you still have to do that post the surgery anyway.
Yes.
Otherwise, what is the surgery really worth?
Exactly.
It's crazy to me that people wouldn't exhaust all of those pieces. And if someone came to you, how long would you tell them to give, to let that really sink in? 3 months, 6 months? Barring like they live their life, they're fine. They're not crying themselves to sleep every night.
Yeah. I would say 1 to 2 months just to see if we can even get to a point where, hey, we're noticing significant enough improvement that if we continue down that path, it would make a difference. But if you're 1 to 2 months in, they're like, pain's still there. They're doing the exercises. They're adhering to the program.
Like really doing them.
Yeah.
And you're talking like just doing some stuff every day?
Every day.
You're talking like minutes.
Yeah.
Like it's not crazy.
Nothing crazy. I mean, a lot of the exercise programs that I give, it's like less than 10 minutes. You're not even going to break a sweat, most likely.
A day.
2 times a day.
Like 20 minutes.
20 minutes total.
What is 30% of your day? Or 30 minutes is 2% of your day? That's right.
Yeah.
Am I doing the math right? Yeah. Less than
I
that.
don't know. I told you I don't like math.
Yeah. Oh, I do that from the fucking worst, dude. I cheated all the time. Graduated cum laude, though. Shout out to me. A lot of help along the way. So, yeah, to do 20 minutes a day of stuff that could potentially improve your overall quality of life and avoid a surgery where, in reality, for it to be even effective or maybe even work, you would have to do the 20 fucking minutes anyway, post it.
Yeah.
That's
I
what.
mean, post surgery, you're doing way more than 20 minutes.
That's where I guess that's why I wanted to hear you say it, because I think a lot of people think like, oh, if I go in and do this back surgery or shoulder surgery or these, I'm going to do a knee surgery, especially if it's both knees.
Well, and that's the thing with both knees. They're not going to do it at the same time.
So you're doing one.
You'll do one, and then you'll get better, and you'll do the other one.
So it's but the rehab has got to be a motherfucker too.
Usually they're like 6 months apart.
What is worse? Do you think like ACL tear or knee replacement?
ACL tear.
No shit.
Yeah.
You
Knee replacement, you're walking the same day.
day.
You walk out of the hospital.
But your peak is higher post ACL.
Yes.
Because
You can, if you do the rehab and you work on the ACL,
you can still play in the NBA.
you'll be fine.
Yeah.
You'll be fine.
You can't get a knee replacement
You're not going to be jumping around.
ever.
You can do a little bit, but you're not going to be doing box jumps necessarily. Like
No. Your ceiling is lower
Yes.
forever.
Yeah.
Because like Klay Thompson does his ACL. Klay still playing in the NBA.
Yeah.
I've never seen anybody like do. That's a real jet.
Ooh.
That's military shit right there. Hopefully you can hear that on the pod. Yeah, that's fucking real time. That's badass. Yeah,
F-16.
that's badass, dude. The crazy guys next door, that's what they do.
Oh, really?
F-16, F-18 parts. Yeah, I train them. Yeah, not just for America. They sell them fucking everywhere. Wild shit. Anyways, last one. So I guess the like the best thing for average people who are like living in pain, whether it be knee pain, low back pain, whatever. What's the first pieces that you would suggest to them? Like, hey man, my body's kind of fucked, but I haven't really tried to do anything other than my own shit, which for most people is little to nothing.
Little, yeah.
Where do you suggest for them to start?
I think it's important to take kind of a self checklist of like, how is my overall nutrition? Do you eat a lot of inflammatory foods? Because if you do, that's going to lend to any small injury, if your body's inflamed, is going to feel a lot larger.
Do you talk to your people about that?
Yes.
And how many of them are like, you're full of shit versus like, okay, I'll listen? Because that's
It's about half and half.
yeah. Because if you're talking like the skill of eating, your kids do it.
Yeah.
It's not fucking hard to learn.
No.
Like my kid does it with a bottle. Like it's not or from his mom. Either way, like it's not. He's sucking, bro. It's pretty fucking simple. Like they innately know that.
Yeah.
You're talking about behavior change.
Right.
Like the skill of grabbing a Pop-Tart and putting it in your mouth or broccoli is the same thing. A behavior mod is tough.
Yeah.
But do you get people to buy in and be like, oh yeah, you know what? The food I'm eating is kind of fucking me up.
I think people have better buy-in too when you break it down of like, tell me what you normally eat in a day. And it's like, okay, well, those 4 things are super inflammatory. How long have you been eating that? It's like, oh, forever.
30 years.
It's like, okay, well, how long have you had knee pain? 30 years. Try cutting those foods out for a week and see how you feel. A week.
Yeah.
Super simple. I'm not telling you have to do some super restrictive diet, but cut out alcohol, cut out simple carbs, and see how you feel for the week. And you'd be surprised how many people report, oh, I mean, pain's not gone, but I feel different.
It's crazy because almost nobody. I don't know. I can't speak for everybody. I work with enough average people who I swear sometimes nobody listens to anything I fucking say. I'm going to repeat the same shit. We talked about this the other day where they were like, I had a guy here. I've talked about fiber and taking a shit here 10,000 times. And he came to me. He's like, hey, I read this email you put out. I didn't know blackberries had fiber in them. And I'm like, fuck are we talking about? Like, this is a grown man who's successful, makes money, like has children. Like, that's where we're at. Yeah. So for you to say to somebody, hey, these foods are inflammatory and they might be causing your, some of your pain, a lot of people don't even think to start there.
No.
And that's where you start.
Yeah.
That makes sense to me.
So look at your nutrition, look at your hydration too. Because I mean, especially down here, I mean,
oh bro,
it's hot. You're sweating all day. If your water intake is not good, your tissues are going to be so much tighter, higher injury of risk too. I mean, I always use the analogy of like, if you're dehydrated, think of your muscles like jerky. I mean,
yeah,
you don't get nearly as much stretch. You don't have that range of motion, and if you are forced through that range of motion, you're higher likelihood of tearing it. And
your fascia, dude, is strong as fuck.
Mm-hmm.
Like, it's like, I don't want to say steel. That's maybe not a great example. But it is.
It's a strong mesh.
Yeah. It is wild. So eat better. Crazy, guys. Eat better. And drink water. Oh, fuck, dude. What was the next steps?
Movement. Like, take a self, intake on, like, what's your day look like in terms of from when you wake up. Everyone has to sleep, so don't count sleep. And you need sleep to heal.
For sure.
So if you're not sleeping adequately, that's a huge one too. I can talk about that. But in terms of your daily movement assessment, like how much movement do you have? How long are you sitting in a chair? And what does that chair look like? So kind of just breaking it down, like, could I stand longer at work? Or if I have a standing desk, I saw you have one.
Yeah.
Every 30 minutes, stand for 2 minutes. It doesn't have to be anything crazy. Well, we're not asking for you to go do a CrossFit workout, but taking that time and changing positions, like your best posture is your next posture. So it's not always in terms of you need to sit with the shoulders back. Like, yes, it's great to sit in good posture, but also your body's going to do better if you're just constantly changing positions and moving.
That's what we talk about, like floor sitting a lot, because you're not going to sit on the floor in the same position I'm in here for 30 straight minutes. Oh. You're going to move multiple times. And I guess that too, like when you look at, if you audit your day, how much time do I spend in hip flexion versus hip extension? Do I touch my toes throughout the day? Do I put my hands over my fucking head and for how long? Do I hang from a pull-up bar? Like really basic human shit, yet we're the only mammals that don't do movement prep before we move.
Yeah.
Like your dog does.
We're also the only mammals that have disc issues. Bipedal.
Isn't that crazy?
Yeah.
To the Swiss balls that everyone used to have. Those are gone.
We have one here.
Can you sit on those other desks they used to?
Yeah.
Nobody does it anymore.
Like on The Office?
Yeah. I remember
Like where Dwight bought one,
Yeah.
and then Jim took the scissors and fucking smoked. He's like, how much that cost? And smoked it. I don't sit on them, but I'm not I would say it's probably better than your
Better than a
shitty
chair.
chair for sure. Just because again,
It engages your core.
you're going to move more. You're going to, you look like a fucking idiot. I go, but like you're going to move more. I like the standing desk for the fact of these where you can go split stance, almost like you're in a box. So one foot's on the desk, one foot's not. Like I can go, honestly, like when my back was fucked, I did some of these podcasts on one knee from an AirX pad. So I do like a split stance and I would just keep moving around. Yeah. It all sounds the same. It doesn't matter. And I could do this standing up too. I'm just being a lazy ass right now. But like, I do think that's a huge piece too. Like if you audit your entire day of
And
what
then
you do.
Within that audit, then you can kind of find like, okay, how much extra time do I have that I could be doing something more beneficial, like a mobility routine or 5 minutes of very easy corrective exercises. You'd find time.
Oh, and again, I'm not judging anybody. I mean, I am. Fuck it, I will. Like, I don't have time to do 10 minutes of mobility. What the fuck are you doing in your day? Like, I'm sorry, but like, you're not working more than me. You're just not. I'm not trying to be an asshole. Unless you're on 24-hour call. But like, if you're a firefighter, bro, you got free.
And they work out.
Yeah, you got that's what they do during their day. Like you can if not, you're not successful is what I'm saying. Like you're the opposite of success. If you can't steal 10 minutes for yourself to make your body feel better. Like there's no amount of money that's worth you feeling like a bag of shit, especially if you're older, you're retired, or you have a different amount of free time in your day. Like again, obviously I'm biased because I do this for a living, but to not spend time doing that when you know whether you do or don't know, like this is the thing that could help you get out of life-altering pain, stiffness, and tightness. Yeah. Yet we don't make time for it. And again, is mobility fun? No, it sucks, dude. When you really do it, like it's not pleasant a lot. It doesn't have to be. No. But when you get better, you push the limits. And I'm like, yeah, I don't like, but I do feel way better. And we say it all the time, like my wife and I, especially when we travel, like how people are alive. Like how are you even alive? Like, and how do you like not feel stiff and fucking tight? Yeah. You know what I mean? Like I hang from a pull-up bar 20 times a day just because it feels good.
Feels great.
And I'm like, do you guys just not feel like compact and tight and stiff as hell all the time?
Gravity.
It's just, it's going to pull you down no matter what.
Yeah.
So those are the big things.
Nutrition, hydration, and then just kind of a daily, you said audit. I like that word. Better.
Yeah.
Daily audit of what your movement and habits are.
And like some type of like program. Like you train for some type of purpose. I do think, I'm not saying you have to do what I do. That's dumb and I wouldn't recommend it. But you have to put some load on the body. Yeah. For bone density, sarcopenia, all the things that you want to keep and then also avoid. You have to do that. Yeah. But a lot of people sometimes they think like, well, my body hurts, I can't do that. I'm like, the worst thing you can probably do is do absolutely nothing. I'll ask this real quick and I'll get you out of here. You guys do anything with, I'm sure you guys do at your clinic, whatever, whether it be like peptide type stuff or things like that?
Yeah, so Dr. Brock, she's our naturopath, and she's a dietitian, and so she does hormones, she does peptides. I'm taking Somorelin right now, which is great.
How you like it?
Love it.
Yeah. We just like 5 days a week?
5 days a week, 2 days off.
Yeah.
Like I said, I got 2 kids, so sleep's not the best these days. So,
but it should help the sleep part of it.
Yeah. And just energy. Like I feel like I'm getting up easier in the morning to my alarm to go work out.
For sure.
Than before, where I'd hit snooze a few times and maybe let the inner bitch win a couple times and not go. Now it's like I wake up and hit the alarm and I'm good to go. I'm ready.
And like again, those are things where we've had all these guys on too. Emily Park was here Sunday. They do all the peptides there, whether it be BPC 157 or now a lot of it's pentodecaarginate with like TB500, which is like the recovery stuff.
Yeah, we do TB4, the frag, which is like the recovery for injury. So getting a lot of patients on that with like severe injuries.
It's not local, right? It's still like just the insulin needles?
That one's actually a tablet you can put under the tongue, so it's liposomal.
Oh, no shit.
Yeah.
Interesting.
Yeah.
But like if you saw someone come in like, hey man, my knees are fucked, whether it be like whatever the case would be, I would imagine you guys would be like, hey, let's try all these things. Mm-hmm. Like if it was me and it was my knees were shit or my low back was shit, and I've done all this, like I went through the whole back recovery stuff, and I'm like, to do BPC 157 and like TB 500 together, I can't say that's it versus I did all the things.
Yeah.
But why would I not do all the fucking things?
All right.
And I think for people, and if your hormones are fucked too,
It's a big one.
You're fucked.
Yeah. Well, just blood work in general. Like, you may not feel inflamed, or you may not like feel like your diet is, but there's a genetic component to that too, where like you could have really high inflammatory markers in your blood, and that could be a huge part of, you know, why you feel like crap all the time and why you're in pain all the time in your knees. And you would never know it, especially if it was a genetic or a hereditary thing, because your diet's locked in, but you could still have super high cholesterol.
So it's like your hormones can be shit. You're not trying any peptides. You're not strength training. You're not doing mobility. And you wonder why your body hurts. The one thing I'll say too, and you probably speak to this, I'm sure, at your place, you can go get the blood work done. You can have, and this speaks to the current medical system versus like kind of concierge medicine. And all of it has its place and all of it is great. And I know great people who work in both arenas. But there is something to be said about, like, again, kind of the mills where your general practitioner who sees 30 fucking people in a day, and maybe he just believes something a little bit different, where you go in and all of your stuff is in range,
Yeah.
but you feel like shit.
Yeah.
And now they're telling you like, oh, this is fine. But to me, it's like, whether it's in range, that's not optimal. And while we would not want to be optimal, especially for like if it's older dudes, right, or older females, or they're going through something like their hormones are completely like at the lowest range or like trash can range, to get those things put back in place, sleep becomes better, which for most people, if that's fucked, everything is fucked. So like and I talked about this a lot of time, it's better you miss 2 workouts than have I got a baby, like have 2 shitty nights of sleep, right?
Yeah.
Because it's like, I'm going to operate on that anyway and push through it. But don't get me wrong, I don't feel like the same person. Like, you're a dead man walking. You're barely alive. So your recovery is much worse. Your performance is much worse. The nagging things that would get healed don't heal as fast. So that's why I asked about the Samorlan, just for the fact of, I do see most people who are on it, their sleep is dramatically improved, whether they have little kids or not.
Yeah. And I even started like doing the Aura Ring lately and tracking like actual like sleep quality.
Oh, yeah.
Massive difference from before I started it.
What time do you go to sleep usually?
Usually like 10 o'clock.
So like when we do all the Versa 4 stuff, I used to track the sleep like religiously. I get too neurotic about it, so I don't know. But most of my deep sleep, like pre-midnight.
Yeah.
Most of mine.
Yeah.
Actually. And yeah, I can tell the big difference between, and even how I eat. If I eat way heavier later versus cut it off earlier, if I do or don't drink alcohol at all of those things drastically impact it.
Yeah.
And again, if your hormones suck and your sleep sucks and your diet sucks, your body probably sucks.
Yeah.
It's crazy how it's all connected.
Well, and to kind of speak on your point too of like concierge versus like your classic medical system, like I had my blood work done like a month ago with Dr. Brock, because I was like, I never really had any done before, just never had a reason to, or I never was found somebody to do it. And so we were going through all of it, and I had a couple things. Testosterone was a little bit low, still within range, but she's like, it should be higher.
Because how old are you?
29.
What was your numbers? Do you want to share them?
I was 460.
That's not super high.
No. But if you go to like a classic medical
They'll tell you you're
physician,
fine.
they'll tell you you're just fine.
If
You're
you
within range.
Well, first of all, if you say you feel fine, they really won't give a fuck. You have to be, depending on what test you do, right? Where you pull it, whether it's LabCorp or somebody else.
Mm-hmm.
What is that range? 300 to 900?
263 to 991.
So you would have to be under 263, 2 consecutive tests in a row, multiple months apart, to even get your insurance to approve it at some point. And even then, they would give you like the littlest shit amount.
Yeah.
That's so fucking insane to me. And I'm saying that because I've had dudes here. I've seen it all. Obviously, I've been in this a long time. So I've seen dudes who do drugs. So they're doing fucking grams a fucking day. Their shit's fucking 5,000 a week. That's bonkers. Don't do that. But I've had guys here, younger and older, where their testosterone has been at like 150.
Yeah.
They're a bag of shit as a human. Not just physically, performance-wise, sleep-wise, but like their mental well-being is not good. Mm-hmm. They go from that to 700, 800. They're a different fucking human.
Different person. Yeah.
Great. Everything. And because I don't mean it just because of the sleep. There's a lot of factors that go into it. But because the sleep improved, everything improved. But because the hormones were kind of fucked, the sleep was fucked. And all those pieces went into play. Now, obviously, there's things like they can get a little bit leaner, build a little bit more muscle if they eat right. But again, it's not fucking magic.
Like if your hormones are better, that's easier to do, to get lean.
Yes. You're literally the motivation in your brain, though. Like and I'm not trying to be in it. Like, women are amazing. They have kids. I watch my wife have one. There's no fucking way, bro. I would even try. I go, but there is something you said about a dude, like, and testosterone. It's why there's fucking buildings, dude.
Yeah.
It's why there's bridges. You know what I'm saying? I'm not saying women don't go build bridges, just not at the same clip. They're not fucking underground building. It's not like that's what the fuck like we do. But when that's taken away from you, you're not that person.
Yeah.
That's why the NFL is the NFL. You know what I'm saying?
Yeah.
Like it's savages, bro. Like everybody's tees on fucking level 10 million. So no, I do think that's an important piece that sometimes people miss. And when you go to your doctor, if you don't have a doctor who, I joke when I say this, I'm like, if your doctor doesn't lift, get a different fucking doctor. And I don't mean that I'm being an asshole. I go, but if they don't understand like what you do in the training, I think that's an important piece. And understanding like, hey, if your hormones are not in a range that are, you know, not even just like normal, but like optimal for you.
Yeah.
Everything else will suffer because of it. Yeah. And a lot of times in the general medicine 2.0, because it's not what they do and it's in the healthy range, it's overlooked oftentimes.
Yeah.
And you're kind of suffering because of it.
Yeah. And that's the beautiful part like about the practice I'm at now. It's like we're able to really get the full picture on people now of like musculoskeletal, how you doing? And if we're missing pieces or we can't figure stuff out, you can go over see Dr. Brock, get some blood work done. And most times that kind of fills in the gap of like, well, that's why. So now we've got this all-encompassing plan for you to get better. And
I wish that was more common too, where you could go in and people would, and again, I always say like in normal medicine, because I love it. A lot of it's great. Like we have great health insurance. And it's nice to go and do shit. And honestly, like I can text the doctors now, which is awesome. Yeah. But they almost need like a behavior mod person next to them after because they're too fucking busy. And I get it, man. But it's nice if you could have someone look at everything because the body it's all one. We compartmentalize it because that's what we do. But really when you look at it like, hey, you know what? You haven't been doing these things. We could fix these things. And oh, by the way, these other, whether it be something as simple as mobility drills or like peptide therapies to exhaust all the avenues. And I guess that's my point for people out there. If you're going to one place and they're telling you everything is fine, even though you feel like shit, and the only route is like doing a surgery, I would say maybe go to a different place and get another opinion. I'm not saying like go to somebody who says rub fucking crystals on your forehead and do some fucking, drink fucking piss out of your backyard. Like, don't do that. I go, but somebody who has a more open approach to the body as a whole versus just the kind of pharmacology surgery route.
Yeah.
It's good shit, dude.
It is.
Where can these guys, did I miss anything?
No.
It was quite a bit.
That was good.
Yeah. I'm trying. I've done this 660 fucking times.
There you go.
Where can these guys find you at? Whether it's Instagram handles, website, where can they reach out to you and kind of see all your guys' stuff?
Yeah. Cation Natural Medicine on Instagram, Facebook, CationNaturalMedicine.com. You can book online. We've got a number on there that you can text as well. So if you've got questions and you want to kind of know what's going on, shoot us a message on Facebook, Instagram as well.
Nice, dude. Do you do stuff on there or no?
Yeah, I put videos on our Instagram page. I don't have my own like personal business account yet.
What?
I know.
What's wrong with you? Dude, you're 25 years old. You're
a
25
big
years
social
old.
media guy.
You're 25 years old. What are you on TikTok or what?
No, I've never had TikTok.
That's probably healthy. Don't do that. I mean,
my personal Instagram is like 6 photos a year. Birthdays, anniversary, Mother's Day.
If my life was different and I wasn't this person, I for surely would do that. But
yeah,
it's changed the scope of my life, so I'm thankful for it. It's not my favorite, but it is just for what you do. I'm not telling you what to do. Do whatever the fuck you want. But for what you do, I would do it.
Well, I posted a lot on I do stories and reels and stuff on our business page.
Yeah, you got to do yours, bro.
Yeah,
because you're the commodity. You're the dude. Because you're always going to be the guy. You know what I mean? Like, yeah, you are no matter what. Like, whether you think it or not, like, where you work, I don't give a shit. Like, I mean that in like the nicest way. Like, you're the person. You know what I mean?
Yeah.
Like, what is Ben's place called? Spire? Or whatever. I don't give a fuck. It's a dumb name. It's Ben's place. You know what I'm saying? Like, that's what I think. Like when I send people there, I'm like, oh yeah, Dr. Hendy works on this. Like, that's what I'll say.
Yeah.
So I'm saying, like, I'm giving you life advice here. Do whatever the fuck you want. I go, but I would do it for the fact if it becomes this online resume of your body of work.
Gotcha.
And it just makes the buy-in for people easier because they'll go on and they'll see you're not like a fucking, you know, like a creep.
Yeah.
You know, like, oh, he's a nice guy. Like, he speaks like a normal human. I like him. We're going to give you all these clips.
Okay, cool.
You got 10 videos right there. I go, but just for the fact of you know what you're talking about, and a lot of people are kind of full of shit. So if you're sharing that stuff and like you show you're working with somebody or showing what you do, it just makes the buy-in easier.
Yeah.
Like, oh yeah, he's a chiropractor, but he does all these other things and help me get out of my hip pain and shit like that.
Gotcha.
I would do it, but
Personal Instagram is Bryce_HendyDC.
and it's going to be blowing up, dude.
There you go.
You can have 10 clips from this video alone.
Actually, let me double check that. That's correct.
I'll be able to find you too. I'll search it out. Is it private?
It is
You got to change it, man. Public.
Bryce_HendyDC.
Yeah, it should be doctor. You got to just start. Let me fucking hook it up, dude. I'm trying to help you out, dude. I'm trying to get you to be able to retire one day. Yeah, you got 2 kids, man. We got to get you out of here.
Yeah.
Thanks, man. I appreciate this.
Hey, thanks for having me.
This is good stuff. I'll put all the stuff in the show notes. You guys will be able to find it. Give them a follow. Hook it up. If you're local, obviously, you guys can pop in. We got a bunch of their cards here up front. Anybody else, give it a like and hook up and follow on Instagram, Facebook, all that stuff. Where am I at here? Reminder, if you guys are on Spotify, drop it a 5-star, leave a comment. If you're on Apple Podcasts, drop it a 5-star, leave a comment there. You can always share it with a buddy, friend, family member who maybe is looking to do, the surgery route or do some different things. Just hear it out. Give them a little different opinion on all that stuff, just in case. It can't hurt. And then again, JeremyScottFitness.app. You guys always get a week for free on me. If you guys want a free sample of AG1, hit me up. I'll have Monica ship it right to your front door. All the other sponsors are in the show notes, Substance Nutrition, JLab, and everybody else. You guys can hook all that stuff up from there. And until next time, eat well, train hard, be nice to people, and please, you guys, keep doing shit you love with people you enjoy because your life is too short not to. I'll talk to you soon. Peace.